Good morning, everyone. On behalf of KSR Institute of Dental Science and Research, welcome you all to the program. Start practice, step-by-step guide. First of all, I would like to pass on my wishes and congratulations to Department of Public Health Dentistry for conducting this program. And I cordially invite Dr. Meghna, Dr. Sendil, and Dr. Mahesh. I'm sure it will be very useful for the interns as well as for the postgraduates who are completing, not only for them, I think even for the practitioners, because I think you can look forward to how you can build up your practice or change your practice. So I think it will be a very useful topic. And, once again, invite all the speakers and best wishes to public health.
Very good morning, sir. Sir, I need admin permission to share my PPT.
Hello, Prasad sir. Good morning to one and all. On behalf of Public Health Dentistry, I welcome you all for this CDE webinar on start practice. First of all, I would like to convey my gratitude to the management, our chairman, Dr. KSR Rangasamy sir, and our vice chairman, Srinivasan sir, for giving us this opportunity to conduct this program. I welcome our principal, who has been a support and guiding force in conducting this program. As he is out of station, our vice principal, Dr. C.A. Matthew sir, who has given the address. I thank you, sir, and I welcome you to this program. And I welcome all the delegates and staff from various colleges, starting from Karpaga Vinayaka Dental College, our institution, Savita Dental College, Venkateshwara Dental College, all the interns who have come here to listen to this CDE webinar on practice management. We have three wonderful speakers. Dr. Mainyana Armugan sir, who is the Dean, Admin, and Head of Department, Savita Dental College. Dr. Sendil sir, who is the Professor and Head, Indira Gandhi Institute of Dental Science. And Dr. Mahesh, who is a reader in Karpaga Vinayaka Dental College. We welcome you all for your thought-provoking speech. Uh, and this topic, start practice. Whenever we finish our undergraduation or post-graduation, we are at crossroads of our professional. So we think what to do next. So nearly 20% of us go into post-graduation. The rest 80%, we don't know what to do. So whenever I advise my undergraduates, interns, I ask them to start practice. So go for practice. So as a health professional, it is our duty and to impart our knowledge and skills in providing care to the community, to the patients. So whenever we go out, we want to start practice. So we don't know what to do as interns or as postgraduates also. So this program will shed some light on how to start your practice. So what all, how much investment you have to put, how should be the infrastructure, and not only these things. You have to know how to communicate with patients. So it is not only your skills, not only your infrastructure. You have to communicate with your patients. So these topics, then you have to update your skills. So these topics will be covered in this webinar. I welcome you all to have a wonderful lecture on this practice management. Thank you. I call upon the first speaker, and I will give a short introduction about Dr. Mainyana Armugam. Mainyana Armugam sir is at present working in Savita Dental College as Dean, Administrative and Professor and Head, Department of Public Health Dentistry. He has a vast experience he has provided many lectures, workshops on career building, and he has guided many postgraduate students, and he has given many lectures on very many platforms. I kindly request Dr. Mainyana Armugam sir to start this first session.
Respected dignitaries, my dear colleagues and dear students, good morning to all. So the first topic, the dental practice setup, that is for the interns. So when we talk about the dental practice, so first we should know what is the goal of the dental practice, and to start the practice, and how we should select the place, location, or the building, or the design of the dental office, and what are all the expenditures in it, and what are all the trends which will affect the dental practice. So these are all the things we will try cover in today's lecture. So knowledge is of no value unless we put into our practice. So whatever we know, we should practice in our day-to-day life. So keeping this in mind. So this is a short introduction. In India, around these are all the number of seats available. Approximately 33 student dentists pass out every year. So imagine the situation, how, but even though the numbers look very high, but there are huge opportunities when compared to the population in our country. So what is a dentist is supposed to do? A dentist has to provide the health care and the service, and of course nobody can do without any profit or anything. So even though it is not commercial, but the dentist has to make profit as a small business, and most importantly we have to have the satisfied patients and the harmonious staff to run the dental clinic peacefully and successfully. So practice management, it can be defined as the organization, administration, and direction of a professional practice in a style that facilitates quality client care. We have to, whatever care we are giving, the quality should be the first priority, and the efficient use of time. How do we manage the time for treating the number of patients? How much time taken for each procedure because it doesn't involve only the dentist time, but also the time for the patients. Everybody wants to get it done in a short period of time and reduce stress to the staff and also, of course, financial profitability. So when we talk about establishing a dental practice after we complete our internship, we should first select the place, location, whether it is a residential area or how, whether that area has been a potentiality for growth in future, or a developing area, or near any factories are there or residential areas are there, where it is located, whether all the patients can be approachable or reachable to that place, whether any near bus stand is there. Depending upon that, then we have to select the building. How about what are all the co-shops are there? It should also be somewhere facilitating to our business or the clinic, because something opposite to our profession is there, then it will block our identity or it will place a hindrance. So that also is very important. And of course, how we are going to gain the financial support and how we are going to design the dental office. So first, if we talk about the selection of a place, first we have to do a field study. How many dentists are practicing in that place, and what is the patient flow in that area, and how is their practice. You can get an idea about that. How many undergraduates are there? How many postgraduates are there? And how many of them are, what is their experience. So these things we can check or do a study before we start a dental practice. Or town or country which is surrounded by many villages, good public transport facilities, if it is there, it will be more advantageous, whether it is in shopping complex areas or the main area in a city, heart of the city, which will attract the people, so that even the transient population also can get the treatment done. So these things we need to analyze before starting up a practice. And selection of place. So close to government commercial offices, corporate and business houses, so that the employees can avail the facilities in the duration of their short breaks. Of course, a dentist, when we start our practice, we can have a short MOU with the nearby companies also. So once in a week, or most of the corporates, they also have to have the CSR, corporate social responsibility, and they want to give the dental care for their, they have to give the care for the employees. So we can have a MOU with the companies. So we have to speak with them that weekly once or monthly once we can visit there. And if they give us a space, we can provide the dental treatment for their employees. So as we have studied in our final year subject public health dentistry about different plans, table of allowances. So we can discuss with the company and how they want, so that we can have a MOU with the companies also. So selection of a building. So the dental clinic should be well ventilated, have a proper water supply, adequate drainage system, reliable power connection, parking facility, and option for future expansion. So these are all the points we should keep it in mind while planning a dental clinic. How well we are going to ventilate it. Of course, if it is air conditioned also, we have to look for the option whether ventilation is proper, natural air supply is there, or otherwise we have to arrange for the generator or backup in case if the power failure occurs. So proper water supply is mandatory in the health point of view also, and adequate drainage system, because establishing a aesthetic dental clinic is very easy, but to maintain, so day to day certain problems will come. So while establishing a dental clinic itself, these are all the things we have to give more concentration. So one time infrastructure expenditure is, if we are buying to buy a place on our own place dental clinic, or we are having to have a rented place or interior designing. So if we are planning to give in a rural area, anywhere, of course, it doesn't matter anywhere, a certain point of interior decoration is needed. But even though if it is not very rich, at least it should be a moderate things are needed nowadays in this 21st century. Everybody they want aesthetics, whether we accept or not, it is the truth that patients first they look for the interiors. So even though if it is not very rich, at least we should have a moderate amount of interior designing, so that it looks pleasant for the patients, dental chairs, instruments. So when we talk about the space needed, so these are all the average space, that is per operatory, it will need 110 square feet, and for X-ray it needs 30 square feet. And when the chair increases, we have to have a lab or unit supply area, reception area. So those things we can have a keep it in mind. And preferably in a dental clinic, the entrance should be different, the exit should be different. So there should be a separate way for entry and there should be a separate way for exit. So this is particularly in case of pedodontics. So this, if it is available and if the space permit, separate entry and separate exit is well advised. So when we talk about the design of the dental office, it should be functional, aesthetic, and we should utilize the space available. And a spacious waiting area, work area is needed. Furniture should be durable, aesthetic, and comfortable. And there should not be more number of walls. So a space should be a bigger hall, like that it is more advisable, and a pleasant painting also plays a role. So soundproofing also wherever if needed we can do it. Electrical designing, exact position of the dental chair, wash basin, inlet and outlet of the water drainage should be planned accordingly. So sufficient workspace should be there in the dental chair in the supine position. So in that way we have to plan our dental clinic, and separate radiographic room with lead barriers, and a separate chamber for autoclave and sterilization, and the compressor and generator to be kept as far away from the dental office to avoid the noise pollution. And here we have to note that inviting floor plan is needed. So the reception area should be sufficiently large and there should not be many walls in between. And prioritize privacy. That means two things. In case suppose if some elderly patients or some VIP patients come, there should be a separate operatory to treat them if the space permits. These are all the things we can keep it in mind. Although, and suppose if they have a painful procedure or anything or a long time procedure, the patient may want the privacy. So in that case also we should have a separate operatory in our dental clinic. Nowadays everybody gives more importance to the privacy, that we should have it in mind. And minimalism. So in the dental clinic we should have the, when we are doing the treatment procedures for the patient, we should have minimal equipments and instruments on display, or in the clinic itself everything should be covered in within the properly accessories or the cupboards, because more exposure or more display of the equipments ignite unnecessary anxiety among the patient. So minimal number of instruments only should be displayed in the operatory of the dental clinic. And natural light should be there in the dental clinic. So if you see the design of a dental clinic, so when a patient enters, first should be the reception. From the reception, the patient should be able to go to the operatories. So from the operatory, you can go to the radiographic room or separate operatory for the children, and audio visuals and the doctor staff lab. So this thing can be a model. So there are three basic room designs for the dental rooms, that is H configuration, U configuration and Y configuration. So these are all the, when we have one dental chair, it is like a H configuration. So both the ways the patient can enter and both the ways the patient can exit. On the lateral sides, the patient seating area will be there. The attender can seat. So another one is U configuration, where you can see one way the patient will enter. So the other way, the opposite wall is closed. The other one is Y configuration, a single entrance. Patients, attenders can be sitting at the sides and in between the operatory. So, and down the variations. So these are the different types of configurations in designing a single operatory for the patient and the attenders. So plumbing lines, the main thing when it comes to the dental clinic setup is that we can buy a good dental chair, we can do the interiors, but the problem is plumbing. So the maintenance of the plumbing and those things is a very important thing. If we plan properly, we can run a smooth clinic. It will not have frequent blockage or anything. So the 4 things we should keep it in mind when we plan the plumbing lines. That is water inlet for dental chairs and wash basins, wastewater outlet from chairs and basins, air inlet to chairs from compressor, RO water inlet to the dental chair if required. So if you see here in the plumbing lines, so from the, if you have a 3 dental chairs, so it should be like this. All the 3 dental chairs should have a separate plumbing line which connects to the common this thing. It should not be like this. From one dental chair, we should not run the plumbing line to the second, to the third, and then to the common point. It should not be like that. So each dental chair should have an outlet directly connected to the thing, then there not be much blockage. And if you see the plumbing line, you can see whenever we have the plumbing joints in between the plumbing pipes, it should not be 90 degrees exactly. It should be 45 degrees. That we should keep it in mind. Dental plumbing lines should always never be, you should never use T-joints wherever needed. We should use only 45-degree angle plumbing lines. And secondly, if you have a pipe, when you are joining 2 or 3 pipes, we should always have 245 degrees to avoid that 90 degrees. So this is the main line. So this is the branch line if it comes. So instead of directly bringing the line like this, we can have a 45-degree angulation here and another 45-degree angulation here. Here also same thing. So we should keep in mind this thing in plumbing line. This is very, very important. So like this, if you have the plant room or compressor room, it should be the lining. So when we have the water line, so we should have a sterile waterway in our dental chair, because when the people plumbing line connects means the plumber will do the thing whichever is convenient for him. So when we are discussing with the technicians, we should reiterate or we should pressurize this. I want a sterile waterway. So for the hand pieces and those things, the water will come separate lining like this. And for the spittoon, when it comes, it should be secondly like this. So like this, this line and this line doesn't mix. So this is a separate way, this is a separate way. So that there is avoidance of any infection or cross infection or anything. So, or a contamination. So we should have a sterile waterway in our dental chair. So when it comes to the instruments, we can, while buying the dental compressor, if we have one dental chair means 1 HP compressor, which is oil free with 28 liters of tank, it is enough, more than enough for one single dental chair. If we have planning for 2 dental chair means we should go for 2 HP. So the ideal thing is 1 HP compressor for one dental chair operatory. When we have 28 liters tank, when the power is off, we can have some surplus air stored in this so that we can complete the procedure. So this is recommended. The cost of the compressor comes around to 22,000 to 25,000, a single dental compressor. So next we should go for the auto drain section, which cost 15,000 to 18,000. We should go for the dry air section, and we should avoid that. Some people will say that suction unit which have a self-cleansing and water flushing option is available. We should never go for that. So always select the dry air section, then only it will avoid, it will serve the purpose. So next is the autoclave, the important one. So for a single dental chair operatory, 12 to 20 liters front door, a B class autoclave is more than enough, which will cost 45,000 to 50,000. So for sterilization and hygiene, we cannot compromise anything. So we should focus on those things. So after, once the instruments is sterilized in the autoclave, where will we keep it or where will we store it? We just can't keep it on the table. So we can buy one UV cabinet which will have approximately 20 trays. After the autoclavable, the instruments can be stored in the UV chamber. It costs around 10,000. So next, the financial aspects of a dental practice. That is, we should maintain a proper record of the patient's history. So as per the medico legal aspects also, it is very, very important. And nowadays it is very difficult or it is not advisable to have the paper records. Always go for the digital. So now it is not very costly. If you spend a 10,000 or a 20,000 or 25,000, we can get a good basic details or data entry softwares. You can design it up. So it is always better to have a digital database. At least to start up with, we can have it in the Excel, or scan and have the medical records always as a proof in the medical folder. We can allot one in Google Drive or something like that. We can buy space, and we can have the patient records date wise, month wise, like that. So it is very mandatory for medical legal aspects. And approach, we should have discussed with the chartered accountant also how we have to maintain the accounts of the dental clinic. And from the first year, it is advisable to file the tax return. Even though we are not going to pay the tax, if our income is less than tax also, we have to learn the habit of filing the tax. We can say that income and the expense are same, or there is no much income, so I am falling below the tax paying category. At least that we should file. That is a proof of your income. That is a proof of our business. So in future, if you are going for a loan, so these things are important. So from the first year onwards, have the habit of whatever compliance is there, statutory guidelines, we have to abide by that and start filing the tax from the first year itself. So the dentist, and how will we decide the fees for the patient? It depends upon various factors, that is the dentist and assistant time and the experience and the cost of operation per hour, how long the procedure will take. So prevailing, what is the professional fees which is prevailing in that area, like how we studied that UCR concept, usual, customary and the regulatory fee. So those things, how it is in that area. So depending on that, you can fix it. But there is nothing wrong in collecting the fees. But only thing is, whatever fees we are collecting, we should do the quality treatment for the patient. So nowadays the patients are very much what to say, they are compliant, or they are eager, ready to pay the fees. See, for whatever the other entertainment things they are paying, there is misconception that the patients are not paying. It is not that. So when you express them, or when you tell them what we are doing in a proper way, or so that in a way such that they can understand, they are ready to pay. So only the quality of care is important. So we can charge the fees. So expenditures are two types, that is one time infrastructure expenditure, another one is monthly recurring. Always remember, we should not go plan the expenditure in a small way. That is, if you start a dental clinic, add one by one. Don't be in a hurry to add all the recent developments, equipments, everything in a first setup itself. If the time and finance permits, well and good. Or if you are taking a loan or anything, or in an area where the revenue has to pick up, so there you have to wait and do. First, the basic things. You should have dental chair, compressor, autoclave, hygienic things, etc. So slowly, whatever profit you are making, in that 20% you have to keep for the future investment. So you have to reinvest that. So 20% whatever profit we are getting, 20% should be for the future investment. So you save that. So in a period of 1 year or in a period of 6 months, that 20% whatever your savings is there, buy a new equipment added to your clinic. So that will be a advised principle. Whatever our profit is there, 20% you should save for the future or reinvestment in our dental clinic. So always keep the monthly recurring expenditures less. Don't pull out more expenses, because those are recurring. So estimated cost, if you see dental chair, it starts from 1 lakh or 1.5 lakh, a basic dental chair, RVG unit 35,000, accessories, other instruments, forceps, those things 75,000 will come. Interior design 1,000 rupees per square feet. Lead apron is 5,000, and the compressor, UV chamber, and then the auto drain. So these things, if you have, it will cost around 3 to 4 lakhs. We can start with the dental practice to start with. Then slowly we can add one by one. So monthly overheads, if you see the monthly rent, electric bill, salaries to the staffs if you have any attender, and monthly material cost. So the dental materials, etc. So when we plan for the dental materials, Always remember, every year conferences are going on in all the education institutions, or fairs are going on. We should keep a tap on those things. So depending upon the expiry date of the dental materials, you can buy in the conferences so that your cost will be less. Otherwise, if you anyway we are going to buy for a year, so depending upon the expiry dates of the material and your practice, we can plan and make use of the dental fairs and the institutional conferences for the discount prices. It will be very useful for startups. So clinical trends which will affect the dental practice in India, that is the people and the providers, and then payments, how they are doing that, and policies in the prevailing area. So these things have an impact on our practice. People, the population is getting older and more diverse, and each people's expectation is different when compared to the olden days. Now people are expecting or demanding more things, or asking more questions, and they are exposed to various things about dentistry through the website, leading to and also different disease patterns because our diet, everything has been changed, and care seeking behavior and their ability to pay, and they have become the astute purchasers of healthcare and seeking value for the spending. That is more important. Whatever the patient is spending for their treatment, they demand the value or the quality. How we are going to match their expectations? Of course, all the dentists will try to do the level best to the patients, but how to make the patients to accept that? How to make the patient to understand that? So there comes the success of a dentist. Whatever we should do, we should make the patient understand. So there is something called as a karyogram. When a patient visits a dental clinic, of course, we will examine the dental patient and we can tell these are all the things you are having. This many dental caries is having, like that, this many restorations are needed, and this much amount it will cost. Then the patient will think that if we go to a dentist, he will charge like this. So that myths you have to break. So you make them understand first that they are having so much of problems, or they, that is what is the real status of their oral health status. That is more important. So a free software is available online, karyogram, so everybody can download it. So if we enter certain parameters, it will give you a graph like this. So nowadays all the dental clinics are having a dental system, and then a printer is there, so it is not a very big deal, and a color printer doesn't cost much, and 20 rupees or 10 rupees printout if you buy the cartridge also. So you can have one system and you can have one color printer. It pays for that. It is very, very useful. You can have the software karyogram. It is a dental caries risk assessment, and it displays the risk for developing new caries in the future. And also it will display the chances to avoid new dental caries in the future. So the green part shows that how much the patient has immunity, or how much the chance to avoid dental caries, and what are all the possible reasons for the existing dental caries. And very easy to input the parameters depending upon the DMF value, and the method of brushing, method of diet, and whether he uses fluoridated toothpaste or not. So based on the clinical judgment, if you enter certain clinical parameters itself, the graph will be displayed. What is the advantage is, if the patient comes to your clinic, if you examine and give one printout, yeah, oral status for the patient, he will better understand. So you know one thing, why there are more diagrams means our brain can retain the images rather than the words or the text. So if you rather than spending half an hour to explain it to the patient, if you show one printout, it will be, patients are better able to retain the image, so that this graph will be embedded in their brain. Oh, I have only 50% chance to avoid dental caries in the future. Other 50% is the risk. What should I do? That will be indirectly in their mind. So like that, you can use certain accessories to make the treatment very qualitatively. And then DMFT and DMF index, of course, what you have done, we may think that index taking is a how far it will be useful, whether it is really we have to do or not. In clinical practice, nobody is doing whether it is really important or not. So believe me, DMFS and DMFT is a very good tool for a private dental practice. So rather than, as I already told you, that karyogram shows the caries risk, but DMFT or DMFS, you can have the same index sheet. You can have the patient name in the computer itself, and several charts are available. So if you mark that wherever is the dental caries, If a filling is there, you can mark it as green. All the dental caries, you can mark it as red. Root stump, you can mark it as something or indicated for RC, you can mark it as RC. Like this, if you take a color printout and give you, this image will be retained by the patient. So how many reds are there? So the patient will remember that I have 10 red colors. That means 10 dental caries in my oral cavity. I have to get it refilled or I have to get it restored. So until everything becomes green, you should tell the patient, this is your chart, present oral health status. It is your effort to make it everything green. Then it becomes the patient responsibility to approach the dentist again and again until everything becomes the green. So indirect way of motivating the patient rather than spending half an hour explaining you have 5 teeth, you have 10 teeth means the patient will think that if we go to the dentist, he will tell like this. So instead of that, you make them understand, you make them feel. So then it will be a very useful tool. Then if you charge, the patient will not hesitate to pay you whatever the normal charge or approximate fees we are charging. So counseling sessions, the second one is the health education and anti-tobacco counseling. But most of the private practitioners, they don't feel the importance of it, because health education and anti-tobacco counseling is very, very important in pulling the patients, because always whatever we are spending rather than word of mouth campaign is better one. So when we do a tobacco counseling, a dentist, apart from the doctor-patient relationship, you becomes there, what to say, psychologically also you are being related to the patient. So you are responsible for their holistic health. So when you do the health education or anti-tobacco counseling, you tell them this is for your health. How much have you? So directly, if you tell anybody stop smoking, means they won't understand. Of course, we have seen the recovery rates are very, very less in Indian scenario. How we are going to address this issue? When we are talking to the patients, you first attack. So how in a movie everybody will do? So villain, if they want to do anything, no, they will kidnap the persons or they will blackmail with the loved ones of a hero. Like that. So if anybody will get attracted to our children, so you first ask what is the relationship, how is the relationship, what is a patient belief or patient thinking to make his son to become in his life. Sir, what is your dream for your son? What you want your son to be? Or what have you done for his improvement? Like that you ask. He will tell so many things. What preparations are as a parent, how you have done. And then you ask, you show the expenses. Anti-tobacco form is there. Several forms are is there assessment. So you can tell them this much you have spent for the tobacco products. This much your effort only you have taken for your son's development or your children's development. You said your children's development is very important for you. You want your daughter or children to become like this. But this much money you have wasted in this. If you have properly used these things in the for your children's growth, then your dream will become true. Like that, we have to slowly come to that. We should not directly attack the patient. So instead of that, you bound them with their love and affection. So then it will be a very good counseling. Then if a person quits smoking in a family, the whole family will consider the doctor as God. So that is the what to say, the power of anti-tobacco counseling. So we have to teach those things and we have to take some time and to do that. Believe me, even though if you spend 1 hour for a patient, after within a year it will repay you, because the patient, that whole family will tell this, because of my husband went to this doctor, he only made my husband to quit this habit. Like that, they will talk about the dental clinic to everybody. You will get the patient. These are all like FDs, fixed deposits. You gain good name. It will keep paying you interest every year. Every year, if you one patient also, if you refer one patient also, it is good for you. So like this, we have to make efficient use of whatever the counseling sessions available. And the payments, of course, nowadays there are different modes of payments are available. So a dentist has to make them available in the dental clinic. Of course, like abroad in India, there is not much dental insurance is there. So that is one limitation in dental treatment in Indian scenario. But of course, we have to, whatever the patients are paying, we should make them quality care is provided to them. So practice implications. So that is, with the increased demand for value in dental care spending, practices to be more efficient. So we have to complete it, do the necessary things in a sufficient period of time. and the trend towards larger multi-site practices also will continue. And all the skills learned, whatever we learn in the institution or with the guides or with our teachers, everything should be implemented in the clinical practice. Then only we can become success. So financial management, if you think we should invest wisely, as I told you, 20% of our profit should be for the reinvestment in a dental clinic. And don't be in a hurry to invest too much in the beginning itself. And if we have loan or anything, we should repay it promptly so that it will have a good track record for us in the future also. And there are different types of loans are available in the bank. Doctor's loan, overdraft account, that is a current account. And there is a doubt that whether we should have a separate account for our dental practice or not. Of course, it is advisable to have a separate account for the professional thing, because when you are going for the loan and all, if you have the separate account, it will be helpful. And there is a dilemma among the students that whether we should open a savings account or current account. So the major difference between the savings and current account is, in savings there will be a, whatever investment we have will fetch interest. Current account will not give interest. Then why does the current account exist? So current account is mainly for the business accounts. That is, you can withdraw n number of times, and we can withdraw more number of amount. That is 1 lakh, 2 lakhs, 3 lakhs. You can deposit and withdraw anytime. But in savings account, there is some restriction. So depending upon your money flow, you can decide. Initially, you can have the savings account also. Later, you can start on current account and shift to that also. There is nothing problem. So the basic difference is, savings will fetch interest, current account will not fetch interest, but you can deposit more. And if your business is depositing more amount of money and withdrawing more amount of money, and you are paying checks for the vendors more promptly or more regularly, we should have the current account. So if we have the clinic account, it is advisable. So most dentists forget what will happen if any patient sues us. So the medical legal problems, what happens? We are seeing something, whatever happens in the newspapers or in India itself. After some procedure, if the patient is not satisfied, he goes to the court and files the case. So in that cases and all, how a doctor can protect himself. So we have learnt about the insurance policies, mediclaim policies, etc. But most of them forget about the professional indemnity policy. That is, it is specially designed for the recruitment requirements of different professionals and professional services. It is available with all the insurance providers. Government one, Oriental Insurance, and then Reliance General Insurance, it has the policy, and Bajaj Finserv has a professional indemnity policy. That is like a life insurance. We can take the, suppose for example, if I take 2 lakh coverage, I have to pay some 10,000 or 15,000 per year. But if anybody sues me and asks me compensation up to 2 lakh, the insurance policy company will pay to the patient. I don't need to pay. So like the life insurance, I have to pay a premium every year. And after that, if any cases arise, unfortunately, the insurance will take care. So it is also mandatory nowadays for a dentist to have this policy. It is not very costly. You can, but before taking the policy, it is mandatory to read the terms and conditions. You first ask the insurance agent or insurance company, what are all the facilities he will give. That we should not ask. We should ask, in what are all the cases he will not give money. Negative things you should first ask and learn, because negative things they will not put in bold letters, they will not write in very big letters. We will forget it, and later when we claim, there will be some miscommunication. So always when you are taking any policy, ask for the negative things first. In which are all the cases he will not give insurance coverage, that I want to know. What are all the subclasses under that? Those things we should learn. So you should go through the, if you search in online, there will be so many policies will be available. First, I advise everybody to go through the document and read by yourself rather than asking the agents, because agents are more focused on selling the policies. They are not very much interested in explaining you everything. So first, don't ask anybody. You first search on the website, what are all the different policies are available, what are all the terms and conditions. You try to understand. Then you approach the office for more clarification. Then whichever, if you are satisfied, whichever you feel suitable for your dental clinic, you can select the policy, but it is mandatory to have the policy and website. So more than that, in this 21st century, your clinic should have a website. So website will not cost much. It will maximum cost 15,000 per year, which is roughly 1,200 per month, which I don't think it is a very big expense for a dental clinic, because we are doing recharge for the mobile itself for more than that, I hope. So each dental clinic should have a website for your separate thing. It should be simple but aesthetically designed. And the major thing is, if you have a website, it should have regular updates every week or once in 3 days. We should keep updating. It should be live. And we should take care of privacy in the website. We should not expose any patient photographs with their identity revealed. It is very, very important. We have to get permission from the patients before doing that. Otherwise, you mask their identity and do that. And give what your patients need in the website. Whatever we learned, we should not put it in the website. No. Whatever is the unique features of your practice or unique services you are providing, depending upon the experience in your dental clinic, what are all the normal doubts or the questions the patient are asking, what is the normal myth, what are all the misconceptions about the dental treatment the patient is having in your experiences, those things you address in the website. Not whatever you know, whatever is the textbook, don't put it in the website, because those things they can surf website and they can find themselves itself. So what messages or what content about the dentistry is not available in other sites, you should put it in your website. So it should be more customized, not a common one. So if we have a website like that, it will definitely reach the people. And definitely, believe me, it will repay you. If you spend 15,000, definitely you will get 3 times more than that minimum in your practice. So you should have one website for your dental clinic, definitely. So if you do the recap, so what we have seen, so first is the selection of the area. It should be a residential area or near a governmental organizations or near factories, so that we can have some MOU with the thing. And minimal investment. Don't be in a hurry to invest too much. We should have a dental compressor. We should have a auto drain suction, and we should have the UV chamber. These are all mandatory. And then if you come, professional indemnity policy is very important. Website is important for your dental practice. And then designing the plumbing lines, you should get a good technician for that. So that is more important. And then dental treatment accessories, that is the karyogram, DMFT, DMS chart, and the most efficient tobacco counseling. These things you should have it in mind when you are treating the patients. So these things, if you remember, so for a startup, it will help you. Thank you. If anybody has any doubts, I can tell you.
Thank you, sir. Thank you, sir, for your wonderful presentation. It was informative. I think it would have helped the students to gain some knowledge on setting up a clinic. Any queries can be put in the chat box. As of now, there is no queries. So we will, if there is any queries, can we attend it in the last, sir?
Okay, sir.
Okay, sir. I welcome Dr. Sendil, sir, for this program. I hand over the mic to Dr. Rajeshwari to introduce Sendil, sir, for the next session.
Good morning, everyone. The doctor-patient relationships are an essential component of any healthcare profession, especially so with the dentistry. So the effective communication lies within the art of dentistry. Now I would like to introduce the next speaker of the session, Dr. Sendil, who's currently working as a professor and head the Department of Public Health Dentistry, Indira Gandhi Institute of Dental Science, Puducherry. He has received the Prime Minister's Letter of Appreciation for Social Responsibility and holds the responsibility of consultant for National Oral Health Policy Development, the Ministry of Health, Government of India. He is appointed as a task force member to develop operational guidelines for basic oral health package in primary health care by Ministry of Health. He is a chairperson in IPR cell, Sri Balaji Vidyapeeth. He has 12 patents and 19 copyrights. He has 5 awards and 18 publications. He has pioneered 2 dental health projects. He is currently editorial board member in 2 journals. He developed 13 MOUs for dental public health services, and he has organized more than 70 dental health programs and more than 1,000 dental outreach activities. And he has guided more than 200 short-term research projects. He has more than 20 paper presentation, guest lectures, and interviews in channels. He played a key role for collaborating the department with the University of Iowa for a student exchange program. I welcome you, sir. Now I hand over to the session to Dr. Sendil.
Good morning. Thanks, Dr. Rajeshwari, for the wonderful introduction. And I think Dr. May Nyanam is there. Hello, sir. Dr. Prakash, I think I can see a couple of my colleagues. Thanks for the invite, and thanks to the entire team of KSR Dental College, heading by Dr. Sarath Ashokan, who is my senior and a good friend. And thanks to Dr. Prakash for giving me an opportunity to share my experience on communication skills on this practice management session. So let me share my screen first. Okay. Is my screen is visible?
Visible, sir.
Okay, fine. So who will be coordinating from that side? Because I thought let me try to have some interaction with the participants also. So somebody can help me out from the organization side for some interaction now and then, because taking a virtual guest talk is a little tough job. So let me be little interesting to my level best, so that the audience can have some take-home message. So Vanakkam. So already they have introduced me. So I'm Senthil, and trying to do something in dentistry for all these years. And I always like Abdul Kalam, and he has told a lot of inspiring quotes, inspiring journeys, and a lot of things I admire on him. So when it comes to this, Abdul Kalam is a trendsetter for certain things in the country. Can anyone tell, is anybody likes Abdul Kalam here? They can open up and they can tell why they like Abdul Kalam. They can unmute.
As a scientist, rocket scientist, I like him, sir.
Okay, great. Anybody else? If you want, I can also give you a slight clue. He has one
good human being,
which relate to this today's topic, what I'm going to speak also.
Simple and good human being.
A simple and a good human being, great. So 2-3 things I like on him, since thanks for the good interaction. First thing I predominantly like him is my father used to tell, don't dream, but he's the person who told me dream, 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 let your dreams be realistic. So most of my dreams I have tried achieving it, and I tried doing something. Thanks for those kind words. But one thing which is related to today's topic is he is the first president who broke the monotony of a president's role. Anybody knows? Because normally presidents will not be expressive. but he is the first president who came out of the cocoon and speak what is his rights and what he does. And even he rejected few bills which is benefiting the policy makers. There is one famous bill he rejected outrightly and came out to the media and said, why I am rejecting, because it is benefiting only the policy makers. So he is the person who come out and start communicating with people, and he also set a trend how a president should be, president of a country should be. So in that way, I like him. So today is about art of conquering patients. Initially, I will tell, however, how much good clinic you have, very good treatment you have, very good infrastructure you have, as Dr. Mainyanam has already said, how to invest and how to reduce your investment, how to increase the efficiency of your instruments, and how the design of the clinic, ergonomics, and all these things. That is one important, but whatever you do, until otherwise you talk to your patient and convince them, they will not recognize the services or the facilities what you have. So to begin with, many a times an organization will fail to grow if we have a lot of communication gaps. So tomorrow, I think predominant audience are interns or mix of interns and postgraduates. Can anybody help me out?
Interns, mostly interns.
Mostly interns. Okay, fine. So tomorrow you might be starting your own clinics, or you might start up a bigger practice, or you might work in any corporate setup. So the growth of any organization is to reduce the communication gaps. The communication gaps can be between your staffs or with the patients or with your higher ups and all these things. One classical example I just want to show you how a communication gap. It is a small game. I'm just trying to play a video, and after this video somebody can open up and let me see whether the video is visible. Somebody can help me out. Is the video is popping out?
Yes, sir.
Can you see the video?
Yes, sir, it's visible, sir.
Okay. Next question is whether the audio is there?
Yes, sir. Yes, sir. Everything is
fine. Everything is fine. So since it's an online, I'm rewinding it.
நம்ம எது பண்ணாலும் இந்த உலக நம்மள உடனே உத்து பார்க்கணும். நாதாரித்தனம் பண்ணாலும் நாசுக்கா பண்ண. I am very happy. Start music. ஐயோ ஐயோ சார், சினங்குண்ட சிங்கத்தை சிறையில் அடைச்சீங்கன்னா அது செல்லையே செதச்சிரும். பரவாயில்லையா? இதுக்கு தான் ஊருக்குள்ள ஒரு ஆளினார் அழகராஜா தேவைங்கிறது. தரைய தொடடா, சாவு அடிக்கிறாங்களே நீங்க. டேய் தொடடா, கீழே தொடடா.
ஒத்த ரோசா ரொம்ப மரியாதை கொடுத்துட்டாவ. வாட் யூ மீன்? என்னம்மா தப்பு பண்றீங்களம்மா?
மங்கிஸ்தா கிங்கிஸ்தா கிங்கிஸ்தா பாயாசா.
சிறப்பான தரமான சம்பவங்களை இனிமேதான் பார்க்க போறேன்.
So can anyone open up and tell what do you understand?
Yes, sir. It depicts how a message is conveyed between persons.
See, that is the basic problem. When you are leading a team, and when you are not communicating properly, the last person will get a different message. The most of the things in India happens like this. The policies are there, rules and regulations are there. When it comes to a common man, we don't understand because the middleman plays a major role. So what I'll trying to tell by this video is reduce your communication gaps between your patients, between your subordinate, between your colleagues, between everybody. Okay, so that you can have a good work environment. So coming into communication, I don't want to go into the definition. It is about information, thoughts and feelings. so that they are satisfactorily received or understood. So coming into why we need a good communication is we are not a business provider, or we are not a trader, or we are a service provider. And it's not only selling solutions, it is about relationship. So we should have a very good relationship with our patients, with our colleagues, subordinates, and everybody. So the communication gaps are predominantly meant to develop a good relationship with your system. And for an effective medical practice, simple logic is, however you do a good treatment, until otherwise you inform the patient how post-operatively the body will behave, how pre-operatively you need to understand, how intra-operatively the things will move on. The effective medical practice will not be there until otherwise you inform everything. Because nowadays I have seen people not telling anything to the patient. Even if you do even if it is a failure, probably we may have to put it in a better terminology that these complications are it's there for the patients. So a simple one example I'll tell you about 4 or 5 years back. I just want to give you an example how a communication will help in an effective medical practice. One example which has happened in my life is about 5-6 years back. I was practicing. One of my bank manager from State Bank of India, where I have my own clinic account and all this loans and all these things. So he came to my practice on a one-day night where he had a pain on the, I think, left or right upper. So when I examined, he had a big cavity in 1/7 and there is one more big cavity in 1/8. So I advised him 1/8 need to be extracted and 1/7 need to be root canal, and both the things need to be addressed, blah, 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 entire procedure I explained. So he was convinced, and I started the treatment. So he said, for extraction, I need some time. So he said, start with the root canal. So I gave him a posterior superior alveolar nerve block. What is a common complication? Anybody can tell me?
Hematoma, sir. Hematoma.
Yeah. So the patient ended up with hematoma. So, and again, for 10-15 minutes, I tell it is a common complication. This is how it behaves and all these things. Give him a pressure pack and all these things. I send him off. I opened the axis and I send him off. And there was a swelling. So somehow I explained him. He was convinced. Then the next appointment he came, he said, sir, root canal, the pain is better. So kindly extract 1/8 because there is some pain. So again, I put an LA, I have extracted 1/8. What is a common complication of extracting 1/8?
Dry socket?
Before dry socket, the tooth came out with the maxillary tuberosity. It happens? Anybody has experienced?
Experience.
Yeah. So again, there was a big chunk of bone and I need to suture it and all these things. Again, I explained him everything. Then after a week, he came complaining of pain. What is the next complication? As you already said, dry socket. Again, I explained him. Somehow I managed to finish the root canal. Then I was totally scared in my life for 6 months or 1 year because after observation, he didn't turn up. And whenever I go to the bank, I used to jump when I crossed the manager's room. So the patient, what happened to the patient next? Because he has to go for a post-endodontic restoration. What happened? Any cases? He did with me, or he did it in some other clinic. What happened? Anybody
Some other clinic.
Some other clinic.
Or postponed.
Wrong, dog. Some other clinic. Then?
Postponed. He may postponed it.
Postponed it. Okay, fine. What happened is after here, he came back to me. So I was also thinking he would go to some other clinic. But after a year, he came back to me. Then I said, sir, I know crown potrupinga nenchine, ivlo complication nadandhuchu appadinu. Then he said, you said everything. No, sir, it is my faith or your faith. We went into a lot of complication. I just want to take some time and get back and finish the treatment before I leave this place, because he got transferred. So he wanted to complete the treatment and go. He came back to me very much. Why? Because I have clearly explained all the complications and I have given some evidences for that also. So it is But predominantly today, when a instrument breaks, also nobody tells to the patient. When there is a complication, also nobody tells to the patient. That is where the dentistry is in a bigger confusion today. So many people tell dentistry is not so great. I will tell dentistry is great. The dentist, it's a question you have to answer yourself. How good you are to your dentistry? So because of this, all these communication gaps, we are losing a lot of patients. Because today in the market, I see that nobody is advising about RPDs, nobody is advising about FPDs. Even now, the dentists have gone beyond, like they do, if the patient comes with the pulp involvement, they don't do a root canal because they plan for an implant, extract an implant. So for an effective practice, we need to inform everything to the patient. And definitely you need to give opportunity for your patients to talk. That is called provider-client interaction. So whenever there is a complication or whenever patient wants to decide treatment, provide them some opportunity to interact with you. And one more, definitely he's a bank manager, well informed. He would have gone to a consumer court, or he would have gone to some court, but litigations can happen. So litigations, any medico-legal issues are happening, it is purely because of communication gaps. If you are not talking to your patients, if you are not talking in his language, definitely patients are going to find a lot of grievance with you and end up with a court. And tangible benefits, one classical example of tangible benefits I learned from my oral surgery professor when I was in final year. So many people give anesthesia. So any surgeons are here in this forum? Okay, I don't think so. When I was doing my undergraduate way back in 2000, as a final year student, still I remember he's my mentor in oral surgery, professor of oral surgery. That time he was an associate professor. So when we are anxious, when a final year case is given, we normally give an anesthesia. And we will check for all the parameters of working. And when we start elevating or luxating, no patient will tell. So we were very anxious, and I went and told, sir, anesthesia is working, patient is not cooperating, please come up. He said one thing, I think your local, he checked whether local anesthesia is working with a lot of viva questions. I tried to answer everything. And finally, he said, local anesthesia is enough, go and give vocal anesthesia. Can anyone understand?
No, sir, I can't understand.
Pardon me?
Vocal anesthesia, I can't
Vocal
understand.
anesthesia, we normally don't tell to the patient. This is how the extraction will be. This is how your feel will be. And many a times I've seen surgeon, no? So one day it has happened in my clinic. My friend surgeon has come. I had a extraction of 1/7 and one root got broken. And I was trying to remove, since he's a surgeon, he came, he said, I will do it. Half an hour he's been trying, but not even he has uttered a word to the patient, how long it will take, how difficult it is, what I am doing. So the patient's expression is going on changing. And as a dentist, we should always try to have to understand the facial expressions. And we read about muscles of facial expressions, but basically we need to understand, because there are a lot of clues the patient gives on their face. So that is one more thing where the undergraduates has to be taught, has to be learned, has to experience. So these are some of the tangible benefits. So coming into aim of my presentation, at the end of this presentation, change your perception about how to communicate with the patient. So probably you should understand the need for good communication, how this can be improved, recognize different ways of communication, doctor-patient relationship, decision-making in treatment, and self-assessment of communication skills, and enhancing two-way communication between doctor and patient in limited time encounter. So these are some of the things. Probably I will try to give it in another half an hour or 40 minutes with some kind of an interaction now and then, so that I am not left alone in this virtual platform. So why good patient communication is important? Again, I will start patient satisfaction. So this is me. And my wife was treating for some dental issues. So very good patient satisfaction, because we used to communicate with the patient in all good moods. Clinical outcomes. So definitely when you talk to your patients, even if you manage with complications, the patient's outcomes, patient should feel, because 50% only is the medicinal value. 50% is the patient's feel good syndrome. So the way you convince, the way you talk and way you explain things, definitely clinical outcomes are better. And normally when it goes for research, this is where they call it as a have-thrown effect, where if the patient feels I have taken a medicine, it is getting cured, then definitely there will be some amount of cure. The same feel you can give it when you talk to the patient, things will be better, you can handle it better, and things will be cured. So that belief will face the situation and come out of it. And benefit to the patient, definitely. Can anyone tell me which is the best method of propaganda for your dental clinic?
Patient's own mouth.
Yeah, that's called word of mouth. So when you talk to your patients and your patients are satisfied, they are the very good brand ambassadors for your practice. They will take care of your practice. But eventually what I see in the society as a public health dentist is established practitioners. Their practice is good. They have too much of patients, but they speak less to the patient because they don't have time. So in this ball game, many patients got confused, but they can afford to lose patients because their practice is like that. You know what happened to a young practitioner? Young practitioner, they are not trying to develop their soft skills, so they doesn't know how to talk to the patient. Probably these kind of lectures or this kind of seminars, or as and when you experienced in your clinics, you have to improve your soft skills. That is called your communication skills. So social role of doctor, can anyone tell me what this doctor is doing? Or what the patients are trying to do? So normally when a patient comes, how do we decide? The treatment charges?
Will they pay for treatment charges?
Pardon me?
Whether they can afford for treatment charges, sir?
That is not a right parameter, really, doctor, because if they cannot afford your treatment charges, they need to go to somewhere where they can provide a teaching institute or a public sector, all these things. So many times what happens in the practice is, based on the patient looks and the pocket we charge. That is itself the wrong communication. In my clinic, what I do is, there is a treatment charges which has been established, but I don't publicize it, but it is available somewhere in the clinic, where we show this is our charges, and these are the charges we work on for our investments. As Dr. Mainyanam has said, you have your own investment, you have your own ways of putting money. So you need to decide for your expertise, for your experience, and for your expenditures, what is the cost, and it has to be made transparent. And that is a kind of a communication there. So whether you talk to your patient about the charges or not, you are communicating to the patient somewhere in some means that these are my charges and this is what I do. But in many clinics, that is not happening. Again, a lot of associations have come forward to regularize the charges, because this is again another ball game where we are losing the patients. I can give you one example. When I was going as an interviewer to a TV channel, the co-anchor was asking, I will put the same question in this forum, why dental treatments are expensive? This is the question your patients might ask. This is the question the co-anchor has asked. What will be your answer? Here comes our social role.
Investment.
Only investment.
And dental material charges.
That is in every medical field, all those things are there. No, why he's alone feeling only in dental clinics? He's not feeling in an orthopedic clinic. He's not feeling in a pediatric clinic. He's not feeling in a gynecology clinic.
Because patients think that dentistry is very simple. Patient's mind of thinking.
Probably not simple. See, I will tell you, patient thinks it is not a life-threatening disease.
Of course, correct, sir, correct.
Okay, patient thinks it is not a life-threatening disease. And one more thing he thinks is, if it is a pediatric procedure, if it is a gynecology procedure, if it is an orthopedic procedure, where he has to go? Only consultations happens in the clinic, where the treatments are done.
Operating room, sir.
Yeah, hospital. So when they go for a bigger place, they think, okay, it is a bigger place, I need to see. The problem with dentistry, we don't understand is 90% of the treatments are done in a 10 by 10 room. So the simple, the anchor was telling, I was asking my friend dentist, the dentist was telling why the treatment charges are more because we get very less cases, so we extract money. That's a very wrong answer. The answer what we have to give is, see, I sit in a practice where I am a dentist, the neighbor is a dermatologist, there is a physician. I see 10 patients in 4 hours maximum. With half an hour I may have to spend for a patient, then probably 8 to 10 cases I see. At the same time frame, the gynecology see how many patients?
1 or 2.
Pardon me?
1 or 2 cases.
For consultation, you are telling about procedures in the hospital. In an evening practice, 4 to 6, 4 to 9, or sorry, 5 to 4 hours of practice. 15 minutes they maximum spend on a patient. They charge around 300 rupees. So what we have to tell to our patients is, dental treatments are time consuming, time is money, time is investment, and a lot of things are happening inside the clinic. So since I'm spending more time on you, the charges are like this. If you go to a dental gynecology OPD and orthopedic OPD, the doctor hardly spends around 10 or 15 minutes. If it is a procedure, they take you to the hospital. Am I right?
Correct, sir. Correct.
We don't understand this issue. We don't talk to our patients. So patients are thinking like that. So they will not come. The one thing you cannot change, the dental diseases or life-threatening. But the other thing we can change, as and when we talk to the patient, this is the issue, this is the charges, that becomes a social role. And as I've already told about tangible benefits, I don't want to spend more time, psychosocial outcomes. So definitely people will feel so good. So these are some of the outcomes of communications. So coming into the importance of communications, how we can communicate is just important as what we say. So it is simple, it is not... What we want to try to say to the patients is the communication and make evidence-based medicine dentistry real to the patient. So now definitely we need to think whether we are providing evidence-based dentistry. I will put a question here. How many dentists practicing implant telling their patients the lifespan? 7 years, 10 years, 15 years, 5 years. We don't tell for the investment. See, you spend 1 lakh, at least we need to tell it comes only for 5 years. The patient will take an informed choice. Okay, I'm investing 1 lakh for 5 years. Because dentistry is also evidence-based. Nothing is lifetime. The patient will ask how long the treatment will come. We need to definitely tell to the patient when natural tooth is not coming for lifetime, how our treatments, if a treatment comes, so that is where the evidence-based has to help us. Any treatment, it has its own lifespan. Improves outcomes for both patients and physician. As I've already emphasized this statement more and more, so I will skip explaining about this statement. Coming into types of communication. So basically what we need to understand is the communication is not only what we speak. There are 2 types of communication. One is non-verbal and verbal. Non-verbal communications are very important, as Dr. Mingyan Arbam has already said about establishing a dental practice. Here, your dental setup should communicate to them what you are intended to, what you are up to do, what is your sterilization, what is your policies, what is your role, and some awareness and some systems. Everything need to be put somewhere. So that becomes a non-verbal communication and a verbal communication. Coming into next, what is non-verbal communication? I think everybody knows. I think everybody has mastered in muscles of facial expression. That is one best non-verbal communication where dentist has to understand their patients. So non-verbal communication is the act of imparting, interchanging thoughts, postures, opinions, or information without use of words. Kindly make a note. We don't need to use any words. The gesture, the sign language, the facial expression, body languages, everything the patient sees. Even if any teachers are there tomorrow, the students are not going to learn from the words. The students are going to learn from how do your body language and the facial expression. That's called role modeling. So can anyone explain what you understand by this picture?
Dolphin circus.
I think one person and only else may know your name, doctor.
Charles Drey.
Pardon me?
Charles Durais.
You are an intern?
No, sir. Staff in KSR.
No, staff. Okay, sorry. Great. Thank you. I think we can give some opportunities to other interns. Anybody wants to open up? Okay. Dr. Charles, if I'm right with your name?
Sir, yes, sir.
Yeah. What do you think of this picture?
It's a dolphin show, sir.
Dolphin show. One thing I want to elicit here is when a human being can communicate to the dolphin without words. He's communicating, right?
Correct, sir.
So why
Yes,
can't
sir.
we also communicate to our fellow human beings? Okay, that's the non-verbal communication. So these are some of the aspects you may have to think. I will explain you for next 5 minutes or so how to improve yourself in your non-verbal communication. Prepare the environment, prepare oneself, monitor your body language and good impression. Let us go for preparing the environment. So preparing the environment is very important. Create a private area. When you talk to the patient, make sure there is no much distractions, because that predominantly happens in the colleges where when we talk to the patient, suddenly somebody will come and tell, if I'm an HOD, whenever I'm a team leader, whenever I'm treating a patient, suddenly a call will come. You have been called by IQAC, you have been called by Dean office, you have been called by somebody, and it will get distracted. So definitely in your clinics, it will not happen. So definitely spend some time, create a private area, eliminate noise and distractions. So many a times, for say, if something is, you can definitely have a pleasant atmosphere in my clinic. What happens is I always play a mild music. It should be an instrumental, preferably, or a mild music, or the patient's choice. Because many a times they put our normal folk songs. If the patient likes folks, that's a good environment. But you should definitely eliminate noise. For say, when you are talking to the patient, somebody is beating some drums outside, which is going non-sync. The patient will get distracted. He will not tell what he has to tell. Then you cannot diagnose. So eliminate noise and distraction. Distraction is your as in final year student, you will be more worried about your viva, you're more worried about your signatures, or more worried about record completion. This is the major issue, that somehow the faculty has to get rid of this thing and make sure they talk to the patient. And provide comfortable seating at equal eye level. This is one more. When you talk to the patient, your eye level and the patient's eye level should be parallel. So if you want to stand and talk, kindly rise the chair so that the patient can see you. Otherwise, the better option is to sit, relax, and talk to the patient. And provide easy physical access. This means many a times what we do is when we start the patient, we sit, we'll ask, what is your name, age, sex, and we'll go somewhere, search for a pen. Then we'll come back and ask for some details, and we will go and search for mouth mirror. So that distracts the patients. So when you are talking to the patient, make sure whatever things it comes to you. Either you arrange everything and start the patient, or you have your own assistants. Whatever you ask, they give it to you. Okay, so prepare oneself. The next thing is, first you have prepared your environment, and then how do you have to prepare yourself for communication, non-verbal communication. I have some distraction, so I get lost. So that is the point I'm eliciting.
Sir, audible, sir? Participants?
No, sir. Screen is not visible. Speaker screen is not visible.
Sorry for the inconvenience. We will get back to you in 2 minutes.
Now, am I audible now?
Yes, sir. Yes, sir.
Sorry for the technical snag. There was a power failure, so my LAN connectivity got disrupted. So again, I'll reshare my. I think you have to enable my screen sharing option.
Yes, we enable.
Admin, kindly enable my screen sharing options, please. It has been disabled. So as I was telling, distraction, again, everybody would have lost the distractions because of this distraction of the technical snag. At times it happens, you may have to again talk to your patients, at least say a sorry, like as I've started, sorry for the interruption, so that they will understand. So right now I need to wait for some time for my screen sharing to be enabled. So in the meantime, any questions are there from the audience? Any feedbacks?
Sir, what about intraoral camera communication?
Intraoral camera is a very good communication tool. Definitely you can, if you are able to afford it. See, today in the market, lot of equipments are coming. Don't get driven by the equipments, because tomorrow you will end up charging every patient just to pay the EMI. All your pulp cappings cases will become RCTs. So have your investments in your control. So you can slowly add up. See, initially, if you don't have an intraoral camera, I will tell mirror will work out, or a selfie camera will work out.
Okay, sir.
Got my point?
Got it.
If you can afford for an intraoral camera with all the means, you can definitely afford it. So this is where the major problem in practice management is. Today in the market, everything is available. I will definitely tell you, today's practice is not patient oriented, it is market oriented.
Sir, what about RVG, sir?
Pardon me?
RVG.
RVG is also a best tool. Again, my question is same. Check your investments. Whether you are affordable for an investment, go for RVG.
Okay, sir.
Otherwise, definitely invest on a X-ray, where a lot of analog you can go for some time. As and when you build your practice, you can add up equipments.
Nowadays, both becomes mandatory, sir. That is why.
Pardon me?
Nowadays, both becomes mandatory, sir.
Who said mandatory? Any government rule is saying mandatory?
For patient.
Market is, doctor, please understand, market is telling mandatory.
Okay, sir. Okay.
Not the government of India. Government of India, your DCA is not telling you need to invest 15 lakhs. They say provide a quality care. Quality care can be provided with 5 rupee also, and very unquality care can also be provided with 500 rupees also.
Okay.
Okay, don't get driven away with the technology. I am not telling technology is bad. Definitely, we need to think what technology we should adopt for our place, our clinic. For say tomorrow you're starting up a clinic in a very in Chennai in Boyes Garden. Okay, definitely a lot of affluent people are going to come, but that time your investments are going to be huge. You should be affordable for it, right?
Right, sir. Right.
So it is our mind. Nobody has made RVG and intraoral camera as mandatory. We think it is mandatory because of the market forces.
Correct.
That is why in India, dentistry is suffering, doctor. Because of our mindsets. Okay, I am trying to share my screen again where I left now. So, is my screen is visible?
Yes, sir. Yes, sir.
So eliminate distraction and interruption. So far, say right now we had some distraction and interruption. So definitely you may have to eliminate it. If not, at least ask a sorry. I've already asked a sorry. Okay, to the patient. Okay, center your attention on the task at hand. So kindly concentrate what patient you are treating, because patients are indifferent. There are certain patients, if you talk 5 minutes is enough. There are certain patients you may have to talk 10 or 15 minutes. So you need to decide how much energy and how much time you have to put on a patient, that eventually you get it by experience only. No teacher can teach you. No system can teach you. Only clinics, per se, you are exposed to more number of patients in your college. Definitely you will get the experience how to talk to the patient. And this is preparing oneself again. Tune on distractive thoughts are concerned. So kindly, when we, I think this photo is very clear because she's I think it is on top of Burj Khalifa. Okay, somebody is taking a selfie on top of Burj Khalifa, and when you climb up there, you should not have any distractive thoughts, and you should be oriented what you are intended to do, and construct an image of what you want to be accomplished in your mind. So kindly have a thought process what you have it in your mind. And coming into the next aspect of non-verbal communication, monitor your body language. I think everyone appreciate the pictures, right? Right? See, Rajini will speak less. What he does more?
Actions.
Acting style.
Style.
அதை பார்த்து தம் அடிச்சவனே நிறைய பேர் இன்னைக்கு வந்து நம்மளால டிசிசியை ஏன் கண்ட்ரோல் பண்ண முடியலன்னா because one point of time Rajini was influencer. When Rajini left,
ஒரு ரீசனா சார்? இதுவும் ஒரு ரீசனா சார்?
ஆமாங்க. ரஜினி தூக்கி போட்டு சிகரெட் பிடிச்சனால அதை பார்த்து சிகரெட் பிடிச்சவங்க நிறைய பேர். இது ஸ்டடியே இருக்குங்க. இப்ப ரஜினி வந்து 5 years முன்னாடி ஸ்மோக்கிங் விட்டாங்கிறதுனால lot of people have left smoking.
Okay.
There is a video when I go for a TCC counseling, I shoot this video. நம்ம சொன்னாலும் கேட்க
Participants, sorry for the inconvenience. We will working on it. Stay for 2 minutes. Sorry. Meanwhile, participants, you can post your doubts in the chat box. We will be looking forward for your doubts to ask to the speakers. Intents, you are most welcome. It's for your people only.
Sir, I had a doubt for the first speaker.
Yeah, doctor. You have doubt to which speaker?
I had a small query for Dr. Meghna. I'm an intern here in KSR.
You wait for 2 minutes. No, let me connect with sir. So, May sir, yeah. Doctor, once we wind up the session, we will have the question, doctor. You hold on here with your doubts.
Sorry again, I have a power fluctuation, so I have started with the dual network where my network is getting balanced now. Because I am there at a LAN network, whenever the power goes, the LAN get disconnected. Sorry. Again, host has to help me with enabling my screen.
Sir, now we can share.
Pardon me?
Now we can share this.
It is enabled. Yeah. So let me again start with the body language. So coming with the body language, your body language is very important. When you talk to your patients, your facial expression, the way you enter into your clinic. See, that is why many a times your faculty will tell, come with a clean shaved face, come with a good dress and all these things. It is just to have a non-verbal communication with your, because you should come to a clinic where you should look like a doctor, not as a patient. So that is where the issue starts. So coming into monitor your body language, conveys as much meaning, and keep the chest area open and arms unfolded. This is always you should see. Always keep your chest area open and don't fold your arms. Keep it free. At times you can fold your arms when you want to show to the patient there are certain informations you want to listen properly so that I'm keen, but not always. Relaxed body position. This is one more thing you may have to see. Face the patient directly. So always try to establish an eye contact. That is very much important. Lean slightly forward and make yourself attractive. So that is one more. Keep an appropriate distance from you and the patient when you talk to your patients, and avoid looking over the rim of your glasses. But many times when the patient talks, if you remove the glasses and see the rims, the patient will think you are not interested. But at the same time, if they are telling some difficult situations, like because of this teeth, I am not able to sleep in the night, I am not able to chew, last 3-4 days I was traveling with the severe pain and all these things, that time you might take your glasses and see, because that is an empathetic response. Remain still and focused on the patient when he is talking about certain crucial things like pain, difficulties, or at times a patient. Yesterday I had a patient who comes to my clinic where he wants severe crowding in the upper anterior, 22 years. He said, I am getting married in another year time, so I don't want ortho option, go for immediate treatment. But we somehow tried counseling and tried ortho is the best option. Putting a prosthetic is lifelong, you will have an issue. So, and the patients are talking little difficult situation because he is feeling, because of his upper crowding, his marriage is not getting fixed. So we have given him options how ortho treatment can also be managed, and his life can also be made better. So coming into good impression. First is the body language. I've already said these are the few points. Coming into the good impression, as soon as the patient entered into a clinic, it should have a good look. Even if it is a very small reception area, please maintain it neatly with the limited things. This is my reception in my clinic. So definitely I have a first impression is the best impression. So I have a registration, have some magazines, TV, information booklets, and even in my, I have displayed, don't bargain. This is not a fish market. And for the money you give, these are the quality standards I am providing in this clinic. After seeing this also, there are patients who comes in bargain. They will tell, sir, on the board this is how the patients are. So we need to definitely understand. But many a times they see the board and they don't come inside and bargain. So definitely you can put your quality standard, not only telling you don't bargain. You should tell you don't bargain here, but we are providing all this quality care. So that should be there. Again, I'll give you a short break here. I'll try to project one dental video. Yeah, this is, I think audio should be there.
Yes, sir. Yes, sir. Audio is good.
So when you don't know what to ask the patient, no, this is the problem. His complaint was when he talks, the tooth is paining, but he has expressed his pain like that. As a young dentist or as a fresher or an old dentist, whatever it might be, we may have to ask multiple questions to get the answer. So this is where the issue starts. Coming to the next part, advantages of non-verbal communication. I'll just push through fast. Reflective and spontaneous, audible and visible, specific informate, encode severity, able to differentiate emotions such as anger and fear. This is the major thing. This normally happens in a surgery department when a student breaks the tooth, no, and everybody will be more interested when the tooth will come. Like the baby is coming out during the maternity, we don't talk to the patient because during maternity, the patient, we will not see the patient face and they will be in a desperate pain. But here we are working on a patient's close to the face and his expressions will go on change. And we need to definitely see the expressions and at least reassure the patient, the tooth will come, it will take this much time and all these things. Okay. So there is some technique to remember for non-verbal communication. I'm going to reinvent what I've already said. Sit squarely in relation to the patient. It's called a solar technique. Open position, lean slightly towards the patient, eye contact and relax. So maintain this open position, eye contact, lean slightly, relax. These are all your clues for your non-verbal communication. Coming into the next part of verbal communication. First is to greet the patient. How do you start a verbal communication? That's what I'm going to tell. Greet the patient. At least tell him, good evening, how are you? I have two practices. One is my new practice. So whenever a patient walks in, because sometimes he goes to the first branch and he comes to the second branch searching of me. And as soon as he entered in, the first question I will tell, how are you and how you manage to locate the clinic? Have you have any difficulty? So some kind of a greeting it should be asked, depends on the way he comes. And I know there are certain patients who comes long way to meet me. That time I ask, how was your travel and any issues on the way you're coming. So do these kind of things you may have to do it. And then start the interview telling, I'll take some 5 minutes. 5 minutes is enough to have a good communication also. 5 minutes, you may have to tell what is the problem. So begin the interview. And this is the next thing. Get a complete account, starting from your medical history, because I don't want to go into your case history examination because all the departments would have drilled you. But end of the day, we don't know why we are taking case history. All 9 departments would have drilled you with case histories, but case histories is to have a better verbal communication to get the entire problem. So you should know what are all questions you have to ask to the patient and receive the patient communication. So give him some time to tell completely. Some patients will tell within 1 minute, some patient might take 5 minutes. So that you need to find out and offer a full account of patient's problem. So then after listening to him, at least summarize. These are the problems you have told me today, we will address it. And check the patient's understanding capacity. That is also, you may have to see what is the patient's educational background, understanding background, psychology and all these things. So kindly have the understanding capacity. So patient will not come up to you. You should go down or up to your patient. Depends on his language, depends on his knowledge. For example, a learned fellow comes, a software engineer comes to me and he comes with a pulpal involvement. I will tell about root canal treatment. I'll tell these are the options of crown. Then I will tell you can Google it and see. Possible? I think many people comes to your clinic with Google informations, right?
Right, sir. Right, sir.
Anybody can talk?
Yes, sir.
So, but the same technique will not be helpful for a person who's coming, who is not educated, who is not tech savvy, or who doesn't know to read or interpret what is given on the web. So for him, you cannot tell Google it and see. You may have to sit and explain for 5 or 10 minutes in his own in his language, not in your language. So that is the thing. Then end the interview. So this is the tell him that today this problem will be taken care, and for other problems you may have to come for multiple visits or next visit. Something you need to tell. So communication skill, practice effective listening skills. Reflect. That is one thing is called reflective listening. Whenever a patient tells to you, you need to reflect at least 1 or 2 words what he has said. And empathetic listening, many times he tells about difficult situation. You may have to tell, oh, I see it was very difficult. Somehow you can manage, and I'm sorry for it. It can be managed. Something empathetically you need to talk to the patient. This is one thing. Use some changes in your facial expression and nod your head at key points and lean slightly forward, as I already said, and make eye contact. Offer a brief confirmation from the patient. And many times you may tell who, hum, I see, all these words you can use, which is comfortable for you. So I am going to give you 10 steps which will help you for non-verbal and verbal communication. To sum it up, establish a good rapport. Like you can see, this is a boating festival in Kerala. So you can see how a good rapport the peddlers have. So one misses, everybody misses. So I have establish a good rapport, respect the patient and be a good listener. That is where don't underestimate any patient. I never underestimate any patient. Even I never underestimate any of my students, because tomorrow anybody can go up and they will be in a position to help you. Be honest. This is one more. This is a bigger question we may have to answer. Don't be honest to your market or your instrument provider. Be honest to your patients. As somebody has asked whether RVG and intraoral camera are must mandatory. Nobody has said mandatory. If you want to be honest to your patient, where you are setting up a clinic in a semi-urban or rural area with minimal investments, you can definitely do a quality care. Obtain an accurate record. And I think many times I ask this question, how many of them are maintaining an accurate record? Today is a very digital platform, and I will definitely tell you 15 years of my practice. Till today, I maintain case histories. Till 2015, it was all manual. Today, it becomes digitalized. Wherever in the world I am there, I can access my patient's record. So you can definitely have to have some records. And many patients have appreciated me when they come back as a repeated clients. They said, you have all the records, just see sir. Or when the patient comes with a different complaint, sir, the temporary filling we would have forgotten. So the case history will tell, again we'll pick up this date I have told, all these things, so the patient will get convinced. So maintaining record is again a kind of a communication. But I have seen 90% of the dentists in the field as a public health dentist, I don't know how many people are maintaining records. Disclose all relevant facts. Tell to the patient, this is the reality, this is how it happens. Explain clearly and ensure that patient understood thoroughly. Am I there? Can I continue?
Sorry, you can proceed.
Yeah, I have another 20 minutes of my stipulated time. I'm just trying to, I'll finish by 11:45 or so. Answer all the questions, applied valid informed consent, and perform follow-up. Obtain valid informed consent is required, and right now it is required to take a written consent. And all my patients, I take a written consent. So during COVID times, I used to take a COVID consent, but before and after, now we are we don't know we are recovering from COVID or no. So now we have slightly swapped to the regular consent. So definitely taking a consent is important, and perform follow-up. So 10 bad habits you should literally avoid for when you communicate with your patient. Dismiss the subject as a matter of uninterested. When a patient talks, many times we answer the phone, or when you are in the clinics, you will be answering your superiors, or you will be answering the fellow colleagues, and the patient will think you are uninterested. So don't give and anybody knows what is feigning attention?
No, sir.
It is called pretending to be attentive. So you might be the patients. There are few patients who are smart enough. They will definitely tell you are not attentive because they would have told some important facts. You will not give an reflection. Reflective listening is not there. Patient will clearly see that you are not listening to him. You are you are pretending to be attentive. And avoid difficulty matters. If many times patient tell difficult matters, we just like that leave it. For him, the difficult matter will be chewing things. Yesterday, the patient came. I'm not able to chew things because so that I'm anemic, so my calcium is going down, so my tooths are getting broken. So this is the link she has. She has a bad tooth. Agree with this, but she linked it with inability to chew. Then he linked it with anemia. Then she has linked it with calcium. Then I said, at this age, she is almost 45 years. I said, you have a very bad tooth because she has went to multiple dentists. She had multiple problems. And many times there is no clear information why the caries is happening. It is a lifestyle disorder. They have not told. I said it is purely because of diet related and your lifestyle. Yesterday there was a post. The dentist has not informed about post-endodontic restoration. So she had a crown, root canal treated. The crown is fractured after a year. The dentist has not informed about crown, and now she is telling because of calcium deficiency the crown is lost. Who has to correct this? Anybody guesses?
Dentist should inform, sir.
That is where the issue is. So the patient is a very good dental patient because as I've seen her mouth, she had 5 crowns, lot of restorations, lot of root canals, and there was one crown, prepared crown. She has not gone to fabricate the crown. I don't know why. So this many confusions are there in dentistry in India. Sit and talk to the patient. You will know what are all the confusions in dentistry in India, and try to correct which is in your hand. The dental practice will be good. Allowing distractions. Finding fault. This is many times we find fault with the patient. No, you are telling not like this tooth will not pain. This tooth will not create any trouble. You are telling something. So don't find fault. For them, it is, even if it is a sensitivity, there are patients who tell it is a severe pain. I will tell this is a pain for you, but as such the condition is like that, it can be managed with this. So don't find a fault with the speaker. And listening only for details, or we will be only listening to whether root canal pannuma, implant pannuma, illa avanukku evlo charge pandrathu, and the details mattum dhaan paapom, michadella vitruvom. So that is also wrong. Becoming attracted by the speaker. So this happens, no? So when a good looking people comes, for both the people, male and female, I'm telling, when a good looking person sits in the chair, don't get distracted. So we normally get distracted and we forget about all the facts. Okay, we will immediately what we do, if a good looking person or if a celebrity comes into your clinic, take a selfie, put it in the Facebook, market it. Am I right? So yes. That is also wrong. Allowing emotionally laden words, that is when the emotions are there, kindly be little slow in telling your words. And taking notes. Taking notes is definitely you have to note down all the things, but when the patient is telling some serious things, don't take notes. Just listen to him for 2 or 5 minutes, then definitely your memory capacity will be there. Definitely your memorizing capacities are better because we have memorized books and books and books. So, but when it comes for exams, we remember. When it comes to our patient, I don't know whether you remember or not. And wasting the advantage of thought speed speeches, many times the patient speaks very fast. So we might lose certain words. So in those occasions, you can definitely ask, sir, kindly be a little slow, or kindly tell what you have already said, or use a different answer. So with this types of communications are over. Last 5 minutes I may take on doctor-patient relationship. So there are different types of patients who walks into your clinic. So your communication should also be tailor-made based on the type of patient walking into your clinic. So for certain patients, whatever you talk, they will not listen. So you should identify the patient and you should talk to them based on the type of patient. So that is also one more art of communication, because at times we full energy கூட போயினீங்க பேஷண்ட் பயங்கரமா பேசுறேன்னு ஒரு டிஃபிகல்ட் பேஷண்ட் வந்திருப்பாங்க அரை மணி நேரம் பேசினதுக்கு அப்புறம் பேஷண்ட் எந்த டிசிஷன் எடுக்க மாட்டான், then you will get drained. So that happens many a times. So try to control that and try to understand your patient. So there are 4 types of patients I think you would have read in your final year or so. So again, I might reinvent the wheel. It is not the doctor-patient relationship which is given in your prostho textbooks, because prostho textbooks is predominant to the complete denture. This is in general any patient. And today, in this 4 types of patient, paternalistic patients are reducing day by day, and predominantly you can see mutuality and consumeristic type of patients, and default is a kind of a patients. I will tell you how they are, and don't waste time on them. Default type of patients, don't waste time. But first three, they are very good to your practice. You may have to deal the patients, and your communication can vary, depends on the type of patient. So I'll give you example. Paternalistic patient is nothing but the patient comes to you and they comes with the mindset of a father and a son relationship. So here, who's the father, who's the son? Anybody can tell? Or a mother and daughter relationship? Can anyone tell me? Anybody is there? 50 people are there. Somebody can unmute. What do you mean by father and a son relationship? Arey Baba, it's a very simple question. Somebody is talking.
The paternal relationship is the relationship between father and son.
Yeah, that's what. See here, what patient thinks is father for you. Who's father, who's son in this relation, doctor and patient?
Doctor is father, patient son.
Yeah, son. So they comes with this experience. Sir, neenga da sir ella. What best you do it. Odane namm enna pannuvom? அவனுக்கு இம்ப்ளான்ட் போட்டு ஜெர்கோனியம் கிரவுன் போட்டு அவனுக்கு ஆர்சிடி பண்ணி எல்லாத்தையும் பண்ணிடுவோம். கரெக்டாப்பா?
Full makeup.
என்னங்க?
No sir, makeup.
I couldn't able to get you. So when a patient comes and tell whatever you want, you decide, you are the best. We that time only we should be very honest to the patient. What is best? What is the cost benefit for the cost? What he spends? It is right. All these things you may have to judge, and you can decide. So you are the boss, and whatever is good for the patient, you can decide. Okay. So this is the way. These patients are very good, and they are very good brand ambassadors. But the day they think you are exploiting him, that's all. You are doing a bigger sin. So these type of patients, you should be little careful. You should be little honest. Okay, not careful. You should be little honest. Okay, we'll go to the next type of patient. Mutuality types of patients are coming, increasing day by day, because it is nothing but where the doctor informs everything to the patient, and the patient discusses everything with the doctor, and finally they both come to a midpoint and mutually take up a decision. For say a patient comes with a pulpily involved tooth, you need to talk about extraction, you need to talk about root canal, pros and cons of extraction, pros and cons of root canal, and the crown and types of crown, everything you should inform the patient, and the patient will have humpty number of doubts. He will get it clarified, and then he will decide the treatment. So these patients are also good to your practice, because you can try convincing the patient, because they will accept the fact. Evidence-based dentistry will definitely work out for a mutuality type of a patient. And this is the major patients which is coming up in India, youngsters. One day I was almost at 9:30, a patient was entering. It's night 9:30, it's not morning. 9:30 I was closing down the clinic. He said, I'm traveling from Bangalore to Pondicherry. In Google I have seen your clinic, and the rating is good, and I want to do a scaling immediately. How much you want, you charge? Got my example?
Got it, sir.
Yeah, consumerist patients is they walk into your clinic and they tell, I pay money, I have seen the treatment, you deliver it. And they are also very good to the patient, because they whatever money you ask, they pay. But what is the danger, you know?
No, sir.
If you do a complication, if you do a failure, he will sue you in court. Got my point?
Got it, sir.
Even for a zirconium crown, you charge 15,000 rupees. He will just like that, he pay. And after 6 months, repeated dislodgement of crowns, if you have not informed, or if you have told the proper treatment, he will sue you in court. That's how consumer is, because they say, I paid money, you provide me the quality treatment. So for this patients, you can talk less, but improve the quality care. First two patients, you may have to talk a lot. so that they will be the brand ambassadors. These patients will not create any propaganda for your patients, for your clinic, because they just come, walk in, get the treatment, they will get satisfied, they'll go to the next clinic, they pay, they get it treated. So consumerist patients are good for the practice, but they are not brand ambassadors. But mutuality and paternalistics are very good brand ambassadors, word of mouth, they do lot of clients. And the next patient is default. இவனுங்களை வச்சு நம்ம ஒண்ணுமே பண்ண முடியாது. இவனுங்கெல்லாம் வந்தா நம்ம வந்து சைலண்ட் ஆயிட்டு அவனுக்கு என்ன கேட்கறாங்களோ பண்ணி கொடுக்கணும். Because they get confused. Many a time I have this kind of patient. They come, sit, first day I will tell about extraction, I will tell about RCT, they'll tell I am confused, I want to I need some time, they'll get you some medicines, and second day they'll come, sir நீங்க மாத்திரை கொடுத்தீங்க கொஞ்சமா வலி போச்சு, இது ஃபில் பண்ணா சரியாயிடுமா, கொஞ்சம் வலி கம்மி ஆயிடுச்சு, ஏன் ரூட் கெனால் பண்ணும், ஏன் எக்ஸ்ட்ராக்ஷன் அப்படின்னு போட்டு உங்களை they will totally kill your time. They will not take up any treatment. Okay, but if you spend time and if you convince this patient, these people take lot of time to get convinced, lot of time to do treatment, but if they are happy with your treatments, they are very, very good brand ambassadors. But you may have to spend more time and energy on them. So this is default kind of patients, because they will not take any decision. They will not leave you to take any decision. They will be only in a confusing decisions, and they will be going on asking questions. They will definitely come to your practice. When it is a busy practice, they'll kill your time. And finally, you'll end up, you will start bombarding on him. Then he will tell, "Enna doctor be patient," and he will create a negative impact on the doctor seriya pesarilla. So you should be careful with these patients. So the last few slides, practical strategies for communication. Strategy 1, good start, body language, listening skills, asking questions, giving answers, partnership, cultural competency. These are some of the things you may have to motivational counseling. Cultural competency is definitely kindly understand the patient's culture, patient's belief systems, and to provide the treatment. There are patients who comes, they say, in this month I should not see any blood. So we may have to help them. We may have to tell them how to postpone the treatment, manage the situation. And empathy and compassion. These are some first strategy, and there is another strategy too, is patient's interest, flexible, describing the issues, responding medically, not pushing your patients. Many times we push it. That is why somebody is asked for RBG, and I think who's the gentleman? RBG is mandatory.
Charles, sir.
Pardon me?
Charles Durai.
Yeah. So what happens here is we invest in RVG and we invest in intraoral camera, and the EMI will be there in our head. Then what we do? Sir, இன்னைக்கே ரூட் கெனால் பண்ணி ஆகணும் சார், இன்னைக்கே பண்ணலன்னா நாளைக்கே பல்லு போயிடும், 4 நாளைக்கே நீங்க ஹாஸ்பிட்டல் போடுவீங்க, பெரிய பிரச்சனையாயிடும். இப்படி சொல்லி we will push the patient. Got my point? Don't push your patients. They will come. So outcomes of effective communication: diagnostic accuracy, greater involvement, adherence to treatment, increased patients and clinician satisfaction. This is the power of communication. It happens in any organization also. Coming to assessment. So all this while I have told. So if you see the importance, and definitely in today in dentistry, lot of communication gaps are happening inside the clinics, and that is why dentistry is suffering. And if we all have to join together, and dentistry has a very good future in India, because there is 130 crore population. But all these dental clinics, all these dental institutes are treating only 10% of the population who needs treatment. Remaining 90% of the population are not coming towards our treatment. In that 40-50% of the patients are not coming for the treatment because of the communication gaps. Either we don't give them clear answer, clear treatment, something. 50% of the people, definitely you cannot, they will tell money is more, tooth is not important. But 40 to 50. So if we start treating 50% of the people involved with dental diseases, all our practices will be good. But for that, we may have to change our mindset. We may have to think what people of India is required, not market of India, because market of India is not governed by dentists. It is governed by multinational companies. We are getting influenced, and they are just for the sake of their business growth. They are trying to do a lot of things. So kindly be careful what is happening around us. Okay. Otherwise, this is the Nalamain Nanikiran. This is the apt video. This is a very good chap. So those who have not understand, I will replay the video. We should definitely understand. So until otherwise we change our perceptions, until otherwise we understand what is the patients of India are required, what Indian dentistry is required, it's going to be a tough journey for next 10 or 20 years, because whoever entering into the field, everybody are going to see like this videos, and you want to slowly improve, the patient will slowly improve if we have a better communication and better informed society. So if you think you are convinced or confused to today's lecture, how you can assess yourself, whether you are a better communicator. So it is going to be some self-exercise, evaluate yourself. Sorry for the spelling mistake, evaluate yourself. So talk to somebody, talk to some of your patients and ask them whether they are convinced, or you can get feedbacks. And video triggering, there are a lot of videos are coming how to talk to the patients, and YouTube is there, and kindly talk to them. Video triggering, many people will go and search how to convince a patient for root canal treatment, how to convince a patient for implant treatment. That is not the way you have to search. Holistically, you may have to think how to convince a patient, or how to make the patients feel better, not convincing, feel better. And video triggering, this is, I know, anybody guesses what film this is? Very classical example. Go and watch the film.
Vasul Raja.
Vasul Raja. It's a very good film. Kattipudi Vaidyam, definitely it works out. You go Kattipudi, shake hand, patient paadi seriya podo. A pat on the back will definitely solve most of the issues. Many times I pat on the back of the patient when yesterday I was doing an impaction. Suddenly there was a trauma. My wife, I was assisting the case, she was scolding me because I was putting the elevator got slipped and it got injured in the palate. It was totally my mistake. Patient dripping with tears. Then somehow we convinced, I put a tap, I said, sorry, it was a slip, it is my mistake. I want to, because you are a little anxious, so I want to complete the treatment fast, so I have given the force. A lot of explanation, 5 to 10 minutes, I stopped the treatment. So you need to, then finally patients finished the root canal was over, and patient was convinced and she was satisfied and she left home. This Munnabai MBBS is Vasul Raja MBBS is a version of Munnabai MBBS. This is another film, and anyone knows this? Both the films are from where it came. That's a very classical film. If you want, go watch that film. I have watched that film. He will come as an angel inside a ward and treat patients. So go watch this film called Patch Adams by Robin Williams. So that's a very classical film, how a doctor should be. Empathetic listening, reflective listening, how non-verbally you have to treat patient. This is the base film, Patch Adams. From Patch Adams, Munnabai MBBS came from Munnabai MBBS. As Dr. Selva said, Vasul Raja MBBS had come. So observations and feedback, role play, just face the mirror, or any two colleagues are there, talk to, just pretend you are a patient and a doctor, try to do, and practice makes perfect. So you may have, patients will teach you many things, and after 15 years of practice also, I might end up with a complicated patient, and I might end up with a patient where I cannot convince. So the teeth is same, the root canal is same, the patients are indifferently indifferent. So finally, I started with Abdul Kalam. So I am a strong follower of Abdul Kalam. It's a small explanation for Abdul Kalam. Aim, bold, dedication, ultimate, loyal, kind, action, love, achievement, motivation. So with this, I finish. It's a mid-morning. So any queries, I'm ready to answer.
So good morning, sir. I'm an intern from KSR.
Okay.
I just wanted to know that since in certain patients like mentally handicapped patients, they need more oral care. So how can we communicate with them to get better cooperation from them, sir?
See, mentally challenged people communicating is basically you need to understand. See, I cannot exactly tell this is the path, this is the way. So, communicating with mentally, today morning also in my OPD, I have a mentally challenged patient where he cannot talk. But normally we can show a thumb sign, we can tell acha, pat on the back. So, a lot of non-verbal clues you may have to use. And if they can hear something, you can use some words. If they cannot hear something, you may have to use a lot of non-verbal clues like shaking hands, showing a thumbs up, or playing with them, or their parents will be there. You should find out from their parents what smooths them or what makes them comfortable. So you need to provide that kind of an environment. So then probably things will be more better. See, simple logic in my clinic, as soon as a kid comes, we give them some pencil, pen, sharpener, some kind of a gift. It's called positive reinforcement for a normal child. So same way for a special children, sometimes they might be very good with cuddling with some teddy bear, cuddling with some. So you may have to ask their parents to bring the objects which are closer to them, with them, so that we can take some clues like this teddy bear is telling. Somehow we need to manage. So definitely we may have to use a lot of non-verbal clues if they are not able to hear. If they are able to hear, then probably we can use some verbal clues. And which will work out, it is practice makes perfect. Today I can sit here and I cannot tell you this methodology will work out. So I basically go to a patient and I try out 3-4 strategies. And out of 5 patients, 1 patient sometimes, see, I will tell you one example. I normally used to treat a lot of special children. At times, we may have to totally restrain them, hold the hand, hold the legs. But one good thing happened. I have extracted with a lot of difficulties, done extractions in special homes. But what happens after the extraction, he was very happy, his pain has gone. One day I was going for a shopping with my daughter and with my family, and he's a special children. It was a very touching moment for me because a lot of non-verbal clues I made and I treated at his home. What happened is in a provisional store, in a supermarket, he just come running away, hug me, he tell he's my dentist, he's my dentist. He was shouting to everybody. And my wife got so moved, she was thinking, you have this kind of patience. So you may have to understand the patient. For that, time is required. You should be little, basically you should not be egoistic. And basically you should think, when you talk to your mentally challenged, you feel that you know nothing. Empty-minded. Then only you can think more. If you think I am a big dentist, I have an MDS, I'm a professor, and I'm this thing, the patient should stand like that, and whatever I tell, they should understand, it will not work out. Okay.
Yes, sir. Thank you, sir.
Any other queries?
Good morning, sir. I'm an intern from KSRIDSR, sir.
Yeah, please.
Sir, people from various economic status will be coming to us. So there'd be a factor called affordability. So if there's a patient from a low income status but cannot afford an implant, is there a way to convince them that that is a better option, or we can go with other?
See, that itself is wrong. You cannot convince them for your charges. See, so for the same situation in my clinic, patient comes. Okay. See, normally I charge around 6,000 to 7,000 for a root canal and a crown. It doesn't mean that everybody can afford, right? So what I will tell them is, see, this is the simple technique we may have to learn. It doesn't mean that all the patients has to get treated in your clinic, right?
Yes, sir.
Yeah. So you may have to tell them clearly, this is the tooth. Root canal is one option. Extraction is in another option. So it depends on the age also. If he is old, for 60 years old fellow, we can tell extraction is a better option. For a 20-year-old fellow, I will tell extraction, you may have to think twice. Okay, then I will tell root canal, this is the cost, and then go to private practices, it will be just 10-20% difference between clinic to clinic. And then if you want affordable care, go to any teaching institutes or a public sector. So teaching institutes provide affordable care. So you have to guide the patient in those situations. So many a times dentist thinks in the patient விட்டா எனக்கு கிடைக்காதே இன்னைக்கு எனக்கு EMI போச்சு நான் காசு வாங்க முடியாது இதை யோசிச்சோம்னா தான் கன்வின்ஸ் பண்றோம். பட் நம்ம எப்படி யோசிக்கணும்னா இந்த பேஷண்ட்டுக்கு ஒரு பெட்டர் கேர் ஒரு பெட்டர் டைரக்ஷன் கொடுத்தீங்கன்னா அவன் அங்க போய் ரூட் கெனால் பண்ணிட்டு நாளைக்கு உங்ககிட்ட ஒரு நார்மல் ஃபில்லிங்க்கு வருவான். Got my point?
Yes.
And definitely public hospitals or teaching institutes, time consumption is more. So many patients have come back to me, sir, நீங்க சொன்னீங்க நாங்க root canal பண்ணிட்டேன். See, even recently, day before yesterday, I had a lower 6-unit bridge I need to cut. He came 1 month before. He was one of the pioneer institutes in Pondicherry is working, and he came with the lower mobile teeth. I said cleaning has to be done, extraction needs to be done. He came. I said the extraction or cleaning உங்க ஹாஸ்பிடல்ல பண்ணிடலாம் சார். இந்த bridge வந்து அங்க பண்ண மாட்டாங்க. So நீங்க எந்தெந்த ட்ரீட்மெண்ட் அங்க முடிக்கணுமோ முடிச்சிட்டு bridgeனா இந்த காஸ்ட் நீங்க என்கிட்ட வரதுனா வந்துக்கீங்க. இல்ல அங்கேயே பண்ணுவாங்கன்னா பண்ணிக்கீங்க. After 1 month he came to me. He said, sir, நான் இந்த ட்ரீட்மெண்ட்லாம் அங்க முடிச்சிட்டேன். நான் bridge இன்னைக்கு போடணும். எனக்கு மெஷர்மென்ட் எடுத்துருங்க. This is the word he said. So the anxiousness comes to us because initially we invest more. That is what again and again I am repeating, and Dr. Mainyanam would have repeating, keep your investments in your control. Got my point?
Yes, sir.
So then you can provide a honest care. And I tell, for my cost, my involvement, if I have to do the treatment, these are my charges. If you cannot afford for my charges, these are the places you can get a same kind of a treatment with less cost. Am I clear, doctor, for your question? I think I've answered.
Yes, sir. Yes, sir. Thank you, sir.
Yeah, lot of, see, even you might tell I am from a place where there is no teaching hospital. Public hospitals are there, but I don't know whether they do root canal or not. Public hospital is primary health center, community health centers, and all this thing. But there are a lot of charity hospitals are there. Even Lions Club is running hospitals. A lot of my friends are working there. They do cost-effective treatments. So you may have to, at least when you set up a clinic, find out where this kind of cost-effective treatments are happening in your place. Either it might be 10-20 kilometers. You can tell in the road in the road in the dentist 10% 20% தான் difference வரும். நான் 6,000 charge பண்ணா இன்னொருத்த 5,000 charge பண்ண போறேன். Treatment is same. But இங்க இருந்து ஒரு 15-20 kilometers போனீங்கன்னா there will be a teaching hospital. This clarity, if you give, the patient will stay back.
Okay, sir. Thank you.
I hope you people got your answers. Any other queries?
Hello, I have a question for Dr. Mainyan.
Yeah, proceed.
Yes, I'm an intern. Yes, ma'am. So, as you were saying about the dental practice, I've heard about something called as Clinical Establishment Act. So,
Doctor, one second. I hope sir is busy right now. I will get back to you once he will get free.
If you want, I can answer. I think Dr. May.
Yeah, sir.
Yes, sir.
Tell me, doctor, you can reshoot your question. I can handle it.
Yes, I've heard about something called as the Clinical Establishment Act. So, what is it about? And
it's simple, doctor. It is like when you buy a two-wheeler, no, you will register the two-wheeler. Same way the government has come out with where you have to register your clinic. There are certain norms. And now all the norms are getting digitalized. Now online platforms are available and they have some specific norms. Like you should have some pollution control certificate, fire safety, and you should have your biomedical waste management, and your clinic should be in this place. And there are few documentation. It depends on the type of practice, and it depends on the setup. The documentation is required, and it is like see, when you go for a two-wheeler registration, documents are minimal. When you go for a luxury car registration, the documentation is more. Same way, if you have a single chair practice, the documentation is less. If you have multiple chair, the documentation is more. And the CEA, I am from Pondicherry. In Pondicherry, I've been registering the CEA and I've been addressing these issues because I am also a part of the dental association here. And here the process is a little easy. In Tamil Nadu, they've started about a year before, and initially there was a lot of hiccups, a lot of cumbers, because as soon as the government starts up the system, there will be a lot of hiccups and cumbers. But right now they've streamlined and everything is online, and definitely getting registration is not a difficult job. That is a process we may have to undergo. Because government wants to know there is an account. Basically, they brought these things for two reasons. One is quackery needs to be abolished because a lot of quackery practice have started. And in India, the problem is there are people who practices with the license who are already dead. The dentists who are already died, with their license, there are people practicing. So all these things we may have to address it. So CEA is a must. And Pondicherry we were able to do for a lot of 4 to 5 years I've been doing. And Tamil Nadu 2 years before they started, and the process is getting streamlined right now. I think I have answered your question.
Yes, sir. Thank you, sir.
Yeah.
Any other queries? Interns can ask their questions. I think they don't have any doubts, sir. I would like to convey my special thanks to Dr. Sendil sir for making this session interactive and lively, and insisting the importance of good communication skills and the doctor-patient relationship, which is a key to a successful dental practice. I hope it was useful to everyone. Now I call upon Dr. Selva to introduce the next speaker.
One second. A very good morning to one and all here. So today our next section will be the enhancing skill. Usually the dentists need both a specialized and a general skills to succeed in their careers. So mastering a variety of soft and the hard skills that include the good clinical, interpersonal and technical skills. So today our next speaker is going to talk about the enhancing the skills. So who is the speaker? Who is Dr. Makesh? He is currently working as a reader in the specialty of public health at Karpa Vinayaka Institute, and he works extensively in promoting general health and the oral health of the underreserved population. So he shows an immense knowledge and passion towards the quality of research, protocol, designing and writing the proposals, applications, and analyzing the data and publications. So he completed his master's in the post-graduation at Babuji Dental College, and he holds his honor in the rank list of Rajiv Gandhi University of Health Sciences. He has 16 scientific publications to his credit in both international and the national journals. He won the best paper in national conferences, both postgraduate as in the staff category. Worked as a reviewer and member in the editorial board for the 2 international scientific journals, and also been as a guest lecturer and speaker at various institutions. We welcome you, sir. The forum is yours.
Yeah. Thank you. Am I audible?
Yes, sir. Yeah. Yes, sir. You are audible, sir.
Yeah.
You can.
Thank you. Yeah. Can I share my screen? Yes. You're able to see my screen?
Visible, sir. You can proceed.
Yeah. I hope it is afternoon by now. So a very good afternoon to one and all present over here. I would like to thank the institution, KSR Institute, for providing me this opportunity. And we had some wonderful sessions. The previous one from Sendil sir and Mayan Armugam sir. So for no need to introduce myself, Dr. Selva has already introduced me. I would like to start my presentation with this quote telling the future belongs to who learn more skills and combine them with creative way. So at the end of my session, am I audible?
Yes, sir, you are audible, sir. Sir, you can have a slideshow, sir. The slides are.
Yeah, the slides are. Is it appearing, or is it in the same slide?
In the same slide, sir. Good morning slide.
Okay. Now, is it visible?
Visible, sir. You can go ahead with the slideshow, sir.
Yeah. Is it fine? Is it visible? The slide?
I think still same. Sir. Slideshow is not.
Okay.
In the left corner, sir.
One second.
Right corner.
One second. Some technical errors.
No problem, sir.
Just see. No, the PowerPoint is not showing. I'll share the screen directly. You can see the screen now?
Yes, sir. Yes, sir. Visible now, sir.
Yeah.
Now it's okay, sir.
Now it's okay, isn't it? Yeah. The screens are moving, isn't it? Dr. Silva?
Yes, sir. It's moving, sir.
Okay. Sorry for the interruption. And yeah, I'll continue my session. At the end of my session, the interns, they will come to know the various opportunities after BDS and how to enhance the skill in each opportunity and whether there is a need for investment. So what to do after BDS? Can anybody answer me? What and all are the various opportunities that you people have an idea after doing BDS? Yes?
Since you can open up. Intern?
Yes, it is an open house. What do you want to do after BDS?
We can try for PG, sir.
Okay, good. So
Or we
majority
can
of
join the army dental corps.
Okay, good. Anything else? Of course, practice the session for the day. Anything else? Okay. See, as Prakash sir told in the beginning itself, that majority of them, if you take 100% of the students, majority of them will try for a postgraduate. Some, if you take the entire person who are trying for the postgraduates, only some 10 to 20% of them will get the opportunity to do MDS. Then the remaining persons and overall people will come under the category where they have to practice. So these are the various opportunity to where the after BDS you can work with. You have certain non-clinical and you have certain clinical. If you see the non-clinical aspect, you have masters in public health, you have masters in business and health administration. You can work with clinical research, you can work with forensic dentistry and health insurance. Before going into the clinical aspects, I want to work with certain areas where you can zoom up or you can get your certain skills in the non-clinical aspects. So before moving into clinical, we'll just brush what and all are there when it comes to non-clinical. The first one is Masters in Public Health. Here, the course fee is around 10,000 to 1,20,000, and it is a 2-year course. The best part over here is it gives various opportunities to work as an health inspector, a research analyst, a research associate, healthcare administrator, and an epidemiologist. And yeah, the expected salary is around 40 to 50K. So this area, it mainly focuses on the science of creating good health in the community through education, research, and promoting health. Organizations of certain NGOs like your WHO, that is the World Health Organization, McKinsey and Company, and various other companies, they hire such kind of persons who have done this Masters in Public Health and like a director of a program. So they'll be giving you various projects to work with, and communication specialist and public health manager and analyst. So why I want to tell this here is, after doing your BDS, you can still focus on this non-clinical area where you have certain amount of opportunities. Then Master in Business and Health Administration. The MBA aims to build a student's capability to meet real life challenges in the field of medicine and management in today's drastic economy. The career opportunities are higher over here. The reason is because if you take a corporate section, even if it is a clinical corporate section, people see not only the graduation or the post-graduation, they also see whether you have very good amount of communication skills, as well as any work which is led to administration, whether we are capable of doing such kind of administrative work. So here in this curriculum, they teach a lot of conceptual and quantitative skills that are crucial for further management in such areas. So here the scale, it ranges from 30 to 1. You can work with certain clinical research, and the areas where you can work with is clinical research physician. You can be a regulatory affair officer. You can be a co-investigator and a medical regulatory writer. So the scope over here is very much high. You can still work with it, and you have various courses like a full-time, like a part-time. You can have a simple certification course and online courses. The next one is with forensic dentistry. In forensic dentistry, you have certain short-term courses, advanced courses. The fee ranges from around 5,000 to 35,000, and whenever you're starting with your regular clinical practice, you can still work with forensic dentistry, where you can work with your own private and legal forensic practice in courts, and you can work with the stations. So if there is a need, like a nearby police station which is there, and they might require any of the information or any of the services which they require, you can address them being in your clinic. You can have your own detective agency also. So these and all are the non-clinical aspects that we have come across. Now let us move into the clinical aspects. What and all are the various ways where you can enhance the clinical skill in your dental practice? So this is how it is. If you take the clinical career, the amount of government jobs, and you can join as BDS staff also in the college and in institute, whereas the majority of the people, they have to have their own clinical practice. And even after doing your post-graduation, there is a need for a clinical practice, and you have various dental wings. in a hospital where you get the opportunity to practice. So what most common thing a graduate do after doing BDS and before joining or before starting up a clinical practice? They usually go and join and work as an assistant. Why? Because people think that after finishing our graduation, we have to go and get some more exposure, improve our communication skill, and see the scenario, how it really works in a clinic. And that's the reason what people usually do is they go work as an assisting. But the most effective way that you can enhance your clinical practice is to get trained with certain amount of courses which is available. So there are various courses which is available and in all kinds of clinical areas. So these are the various fields where you can enhance your clinical skills. So you can work with your endodontics, you have cosmetics, you have your oral and maxillofacial surgery where you can work with the surgery department, and then orthodontics, laser and implantology. So first, when we speak about endodontics, you have two different types of courses. One is your short-term course or a hands-on rotary course. Usually in the undergraduation, after becoming a graduate, you'll be very much skilled with your manual things to work with your RCT. But rotary, it is usually done for the in the syllabus. It is mainly meant for the post graduation. So here, what you can do is you can go and join such kind of short-term courses where you have 3 days course or you have a 1 week course, and this hands-on course, it gives you a trigger. It will enable you to work with how this rotary endodontics work. And you have various fellowships also in this endodontics where you can work for 1 to 2 years. It usually takes a minimum of 3 months, and you have a 1 to 2 years course where you'll be doing n number of cases in that field. So this is regarding your endodontics. Moving on to cosmetic dentistry. Here, this also consists of both certificate courses, you have fellowship courses, and you have PG diploma courses. So in this, if you take, you have certain amount of medical aesthetic areas where you can work in your clinic, such as your trichology and working with nails and certain dermal areas. So here, the patient now in this growing new modern world, people over here expect what and all are the way how they can improve their smile, improve their face, and improve their profile. So in such cases, working in these areas will enhance your skills, and you can practice in your day-to-day practice. So in this aesthetic dentistry, you have certain dental part. So you have certain amount of courses where they teach you some aesthetic part in composite restoration, how to manage an Ellis fracture, and what kinds of a shade guide is must for those kind of patients. Okay, so these things and all you will come to know when it comes to your composite restoration. You have diastema closure. Here, the people, the patients who come over here in city places specifically, they expect the patients where they want to have a very good smile. So in such cases, they treat in these diastema closures and your perio aesthetics. So in patients with gummy smile and those kind of patients where you need to do certain amount of laser surgeries over there. So you get trained with perio aesthetics, and then commercially you have certain cases where you have the patient, when they are affordable, you can go ahead with tooth jewelry, smile designing, and also with bleaching. This all area is concentrating on your aesthetic dentistry, and with this the note what I've kept over here, that is in this website, you will get all the informations, what kind of a course it is. It varies around some 3 months to 1 year. And in this course, the advantage that you get over here is, in this modern growing world, people expect you to do such kind of aesthetic dentistry. So it is always good that we get trained in these areas and work. Then moving on to your oral and minor oral surgeries. Here, if you take the MMC, you can afford for a senior internship. So the part what you can do over here is, MMC, which is there in Chennai, you have to go and address to MMC, the dean of MMC. Here you have to pay around 10,000, and the duration for your senior internship is around 6 months. So these kind of internship courses, you can go ahead where they teach you certain amount of minor oral surgeries like impaction, that is your third molar removal, and certain amount of cases where you can handle patients who come with fractures and all. Here, the advantage over here is, the people who go and work in rural areas or set up a clinic in rural areas, you can get trained more in the surgery aspects, and you can zoom well over there. If there is any emergency in that rural area, you will be more confident in going and working over there. Here, it is not for everybody else. The dean will accept only some 4 to 5 interns to do this internship. So the it works on a first come first basis. You have to immediately go and report. And then similarly, you have in Manipal, you have a certificate course for oral and minor oral surgery, and you have various fellowship courses also in Manipal. Then you have for oral and maxillofacial surgery, you have junior internship. Here, this is not only for one single subject, that is your surgery, even for other subjects also. For all subjects it works, and we know very well that there is a dental wing in all hospitals. And first thing what you have to do over here is take permission from the DMS office, that is the Director of the Medical Sciences. And in this office, it is there in Penampet in Chennai. So you have to go and address over there. The first thing what you're going to do is go and address over there that you will be working in this hospital which is nearby. You have various kinds of government hospitals. For example, you have a Tanjavur government hospital, your district hospital where there is a dental wing. And you have to go and meet the medical officer of that government hospital, take permission from him, and you can do a 6 months of internship. So in this 6 months of internship, you'll be paying a fee of some 30 to 35K, and the course is around 6 months. So with these kind of clinical skills, you can enhance in your practice. Moving on to the ortho courses. In this GDS Dental, you have various ortho courses, and usually these kind of ortho courses they do in 3 to 8 modules. You have MBT technique where they teach about some fixed orthodontics, and they teach you certain amount of case selection and treatment planning. They provide demonstration and hands-on on banding and bonding of patients, and each and every topic are being discussed, and they provide certain amount of 30 to 50 cases. So with this experience, you can even practice orthodontics in your own clinic. Moving on to the next part, that is laser. So here in Laser Academy, Laser Indian Academy, you have hands-on course and you have fellowships. So the hands-on course, usually it is a short-term course where you work for 3 months to 6 months, and whereas in fellowship, it might take even 1 year to 6 months to 1 year, sorry. And here it has lectures and clinical case presentations, and you have hands-on demo on patients, how the laser really works. And hands-on on tabletop models. They'll be giving you certain models like for a soft tissue, they'll be giving a different kind of a model. And for a hard tissue, they'll be giving a different kind of a model. And they teach you both the soft tissue laser as well as the hard tissue laser. So later, the advantages, what you can do over here is you can go ahead with a surgery where you don't have any blood stains at all, a bloodless surgery. Okay, so the scars and all these things and all you can just avoid, and you can enhance your practice. Moving on to the next one, that is implant dentistry. In this implant dentistry, you have certain certification course. So you both majority of the implant, you have certain amount of national certification and you have certain amount of international certification. So when it comes to your BOCI, that is Brandmark Osseointegration Center of India, and the main office is in Sweden. And there are other certification courses, that is International Congress of Oral Implantologists, that is ICOI. And the next one is Global Dental Academy. So moving on to the first one, that is BOCI. Here you have around 4 different modules. In each module, in the first module, they'll be giving you complete lectures, how implant works. And in the next module, they start giving you patients. Okay. And in that, you can start working direct hands-on with the patient. They give you direct patients rather than working on a model. Those kind of models and all you'll get in the first session itself. So in the second model, you'll be working directly on patients. They teach you how before placement of an implant, what is the integrity of bone, and after placing the implant, what is the integrity of bone, even the radiological aspects and all those things. So this is located in Bangalore, and the fee structure over here is around 1 lakh to 1,60,000, I guess. Yeah, and it takes around 6 months to complete this course. So you have various clinics where they teach you to do implants in and out of Tamil Nadu, and all those clinics are attached to this ICOI, that is International Congress of Oral Implantologists. So once when you do certain amount of cases, if you do some 20 training cases, you'll be getting the certificate of IOCL. So once when you are certified, then you can practice in your clinic. Then you have fellowship in implantology with GDA, that is Global Dental Academy. And this is also quite similar to that of your BOCI, where you have some 6 modules. In the initial, the first 2 modules will be your basic lectures, and they will be teaching you certain hands-on with some models. And when it comes to your 4th, 5th, and 6th sessions or modules, they teach you on direct patients itself. And Asian Dental Academy is like a one-stop shop. Here, you have various different courses at one area itself. You can do clinical dentistry in fellowship courses. The whole duration ranges from 3 months to 1 year. You have endodontic fellowship, you have implantology, you have aesthetic dentistry fellowship, the same minor oral surgery fellowship, and orthodontic long-term courses. So if you just go in this website and see Asian Dental Academy, it's like a one-stop shop where you get all the fellowship courses in detail. Even IDA does certain amount of fellowship programs. If they do certain amount of hands-on courses, and it is completely distributed. In North Chennai, you have North Chennai IDA, which does certain amount of courses, and South Chennai, which does certain amount of courses. And this IDA, you have to keep sticking on to this website so that you'll get what and all are the various programs and the updates which is available. So this is also like a one-stop shop where you'll get all the informations. And Savitha Dental College also does some various fellowship courses. And the FDS, that is the fellowship course in endodontics, periodontics, implantology, prosthodontics, aesthetic dentistry, and special care dentistry. Here in special care dentistry, they even treat special patients like the medical compromised patients and the patients who are deaf and dumb and and certain amount of geriatric patients. So here they give certain special training to how to handle such kind of patients. And then you have fellowship in general dentistry also. And then for pedo and preventive dentistry, oral facial pain and radiology also, you have certain amount of fellowship courses where they teach you how to handle the patients with pain, the palliative care, and you have laser dentistry also in Savita Dental College. So here, so it is a complete package where you get in Savita Dental College. The range is around 3 months, a minimum of 3 months, and you have a course till 2 years. And once you get trained over there and come back, you can have an effective practice. Now, the question rises, is there a need for investment? Yes, here you're going to invest. The first thing is your time, because all the 4 years you have studied your BDS, and still we have to study, still we have to gain knowledge or what. Yes, we have to still get updated with whatever the current situation is. So time is a factor where you have to give certain amount of time to gain new knowledges and to practice new skills. Then the second thing is your energy. Yes, you will have certain amount of workload. Whatever that you have practiced in your undergraduation level, like your restoration, your basic things and all, those things and all will fetch you certain amount of money. Yes, of course. But as you practice more and more, and the patient will also come and he is also going to demand you with some difficult cases and all. So how you are going to handle that? In certain situation, you can call up the postgraduates or the MDS persons, and they will come as a consultant and they will work. But majority of the times, what you people will do is the majority of the amount or the half of the amount, it goes to the specialists, and the amount that is being gained by all is less. So if you work with certain amount of certificate courses and workshops, and if you really work with a lot of energy, you can really improve your skill. And the last part over here is money. Yes, you have to shell out certain amount of money too. There might be a question, sir, we have worked with 4 years of undergraduation, but still should we shell certain amount of money? As Sendil sir in the previous session told, like, it is not necessary that you have to shell money for the material point of view, what kind of a big clinic I have to have, or whether to afford for an RBG or whether to afford for your regular radiograph. But going for a course and getting trained when it comes to knowledge is one of the best part of investment. Why? Because even if you're not getting such kind of patient in your initial days, the knowledge or whatever the skill that you have learned will never go in vain. You can still work with it. So if you speak about the various kind of investment, I would prefer telling that if you invest on the knowledge and the skill part, it will last forever. So with this, I'm ready for the questions. Yes, anybody, any queries to improve your skills? I kept it as a very short session. I just want to show expose what and all are the various areas that is available, so that you can go and get trained in those areas. Yes, interns.
Sir, I'm Lokeshwari. intern case, huh?
Yes.
Sir, how to get placed in government jobs, sir? Is there any courses available? Or,
Sorry,
any
Ma,
responsibility?
your voice is not clear. Can you please repeat your question, please?
Doctor, your voice is not audible. You can use the chat box. No, you can post your question. Dr. Lokeshwari, you are audible.
Sir, how to get placed in government jobs, sir, after BDS? Is there any courses or exams we need to concentrate so that we can easily get placed in government jobs?
See, when it comes to your government job, it is what the government announces. You will get those kinds of exams, and it will be announced in the newspaper. And then there is no any specific course for gaining knowledge as such. But if you are doing a good PG preparation, I think that is more than sufficient for you to go and attend the exams for government. Okay, you'll get call first for that, for government jobs, and based on the call first, the number of seats which is available and the number of seats which is distributed, you can give your exams and you can attend your interviews. Specific course to gain knowledge as such, it is not available. You have to read your regular syllabus books itself.
Thanks.
Vishnupriya, have I addressed your question?
Hope yes. Any other questions, interns? No questions. Yeah. You can.
So good afternoon, sir. Sir, I'm an intern from KSR. Sir, I wanted to know, like, since you provided us with lots of options, I want to know which would you best suggest for us to take up, sir?
Very good question. Actually, I expected such kind of a question. See, when you're going to start your own practice, you'll be going to your own location. You have to see what kind of a patient you might require. I've seen a few situations where people go put your clinic in such areas where there are no any oral and maxillofacial surgeons, and there are very less number of endodontists or specialty practitioners over there. So it is basically based on your need. So if you get majority of the patients who are affordable of doing endodontic treatment, then you can go for those kind of shorthand courses. And when you give me an option whether to go for just a short-term hands-on course or to go for a fellowship course, I would prefer you to go for a short-term hands-on course. Why? Because you will get an exposure over there. You will come to know what it is first, and then you will go back to your place where you practice. And in that place, when you get certain amount of patients, then you can work with those kinds of patients. And skill is something like not that you will get it at one stretch. Everybody cannot practice from day one. It is the number of patients that we work. As we work with patients, you will learn how to work with all the different kinds of skills, your endodontic skills or whatever the skills it is. I would prefer because the most nowadays the most common case that you get is endo. So what I have done is I have done my hands-on and fellowship in this endodontics, so that sometimes I've been even called as a consultant in certain clinics. So it really helps you out. So I would prefer you to go for courses which is really needed for you in your area of practice.
Yes, sir. Thank you, sir.
Sir, really thank you, sir. It was really eye-opener for the interns. Hope they will came to know about the few courses. Just they have entered, and it's like they have gained some knowledges. Thank you so much, sir.
Yeah, thank you. So with this, I will end my session. a journey of 1,000 miles, it just begins with a single step. So once you people finish your internship, just see, go back and see which area you people are really interested with and what kind of a patients you will get. And based on that kind of a patient or what kind of cases that you get, you can work with the various courses. Thank you, one and all.
Thank you.
Thank you, sir. I would like to thank the speakers for spending their time to enlighten our interns about starting a practice. As a token of appreciation, I would like to present the certificate for our first speaker, Mainyanam sir. Thank you very much, sir, for coming and gracing this occasion with your thought-provoking speech. Next, I would like to thank Dr. Sendil sir for telling more about communication skills that we should develop while starting a practice. So I thank you very much, sir, for spending your time. Thank you, Magesh, for coming and speaking on enhancing the skills, how we can improve our skills to improve the practice. Thank you very much for giving a wonderful speech. Thank you. Now I ask Rajeshwari to give the vote of thanks.
I would like to thank the management for providing the opportunity to host the program, our principal, Dr. Sharath Ashokan sir, for his support, our vice principal, Dr. Matthew sir, for his presence. I would like to thank the speaker for their valuable guidance in starting the dental practice. I would like to thank Dr. Prasad sir, Professor Department of Oral Pathology, for the technical support. I thank all the participants who attended the webinar and made it a huge success. I thank all the teaching and the non-teaching staff or department for their support. Thank you. Now I request all the participants in the Zoom platform to switch on their video to take a group snap. Kindly switch on your video, please. Thank you. We thank you for your cooperation. We'll send the participation certificate to our mail IDs. You can leave now.
Yeah.